Test, test. Good morning. I need my coach's whistle, but there's just way too much fellowship and networking going on right now. But good morning, everyone. If I could have everyone begin the process of taking their seats, we can go ahead and get our program started. Good morning, everyone. Any educators in the room? If I have any educators in the room, if you'll help me, if you can hear my voice, clap once. If you can hear my voice, clap twice. If you can hear my voice, clap 3 times. If you can hear my voice, clap 4 times. All right, thank you for that applause. I want to thank you all for being with us this morning. And I tell you, when you get healthcare sector CEOs and thought leaders in a room, you welcome just an incredible energy, and we couldn't be more excited. My name is William Wainwright. I serve as president of Southeastern Louisiana University, and I also have the honor of serving as president of St. Tammany Corporation, and I want to welcome you all to the inaugural St. Tammany Sector Symposium, hosted by St. Tammany Corporation, our economic development organization for St. Tammany Parish. We are glad to have you all join us today as we celebrate talent, innovation, collaboration, and the economic impact of our healthcare industry in St. Tammany. Our hope is for this to become an annual event focusing on key industry sectors driving growth in St. Tammany Parish, beginning with this spotlight on healthcare, a sector critical to both community well-being and economic vitality. I would now like to welcome an esteemed guest to the podium. Senator Bill Cassidy is a fierce advocate for Louisiana and Washington, D.C., especially in the areas of economic development, healthcare, higher education, flood insurance, and innovation. And I want to add support for our veterans. I've seen that firsthand through his leadership and support of our veterans who are enrolled at Southeastern. Thank you for that support, Senator. Yesterday, it was announced that he will serve as chair of the U.S. Senate Committee on Health, Education, Labor, and Pensions for the 119th Congress. Congratulations. So proud to have his leadership in advancing opportunities for Louisianians has been evident throughout his career as a physician and an educator. Please join me for a warm St. Tammany welcome. It is my honor to introduce U.S. Senator Bill Cassidy to share opening remarks.
Thanks, Will. Absolutely. Hey, whoa. Okay, I'm on this and that. Oh, good. Okay, let me move that away just a little bit. Hey, thank y'all for having me. I was speaking to Mimi earlier. She said, isn't it exciting? Republicans have everything, whether you're a Republican or not. If you're a Republican, you can appreciate, you are excited. And if you're not, you can understand how Republicans are excited. And you can understand how this Republican is particularly excited because if you have the chairmanship of a committee, you can do a heck of a lot. I have been spending 10 years in the Senate planning for this day. Speaking to people like Jim Tucker, like Pete November, like Will Wainwright, like anybody in this room Joan, who has been able to fill my ear with something which is positive for the state of Louisiana and for our nation. And now I get an opportunity to take your ideas and put them into public policy. And I am incredibly pumped. This, by the way, is a fantastic conference to have. Healthcare is a growing sector in our economy. And of course, you're going to have that employment which is related to the hospitals, to the home health agencies. But you have so much potential to go beyond that. And that is economic development for one of the most vibrant regions of our state. If St. Tammany is doing well, you are an engine that pulls other parts of our state along. So I am here to support you. Now, by the way, let me get to my notes. I will leave early. I would like to stay for your entire meeting. But I teach a class at LSU, and I have to go back and teach. And by the way, the class I'm teaching this semester is on healthcare reform. So it's incredibly apropos. So let's just talk a little bit about innovation. Innovation is incredible. When I was in medical school, which granted is a long time ago, but I remember one of the most common surgeries was taking out a portion of somebody's stomach, because when I say stomach, I don't mean your whole belly. I just mean where the food goes. I'm talking to you like I'm talking to my daughter for a second. And somebody would get an ulcer and would begin to bleed so eruptively that they would have to have a portion of their stomach taken out. And when I was a junior in medical school, a brand new drug came out that revolutionized everything. And that brand new drug was called Tagamet. We now sell Tagamet over the counter. But that immediately took a surgery, which is one of the most common surgeries done at the hospital where I was working, or OK Long Hospital, and boom, it stopped. Within 3 months, it stopped because of a drug which is now sold over the counter. Innovation's incredible. When I was, I'm just old enough to remember that I did not have to get vaccinated for mumps and measles because I was exposed before I went to school. It was so common that everyone was exposed. And the pediatricians, when I finally graduated, told me, oh yeah, I remember when that happened. There are whole wards of hospitals that shut down in 3 months because once the vaccine came along, we no longer had to hospitalize people with complications of mumps and measles. They tell me that the number of kids who are in our school for the blind and school for the deaf have decreased. That's a good thing. And why have they decreased? Because we no longer have the complications of mumps and measles. That is the power of innovation. And I like to say there's someone in this room who is alive, I mean literally alive, because of some innovation in healthcare. You've had a transplant, you've had a cancer treated that 10 years ago was untreatable. You've got Crohn's disease or a disease like that, which you would have had your entire bowel absorbed, taken out, and here you are eating biscuits and gravy. That is the power of innovation. We in Louisiana can be part of that. One of my former students, I used to teach at LSU Med School, and you may have heard me say this, but I was famous for my lectures on diarrhea and hepatitis. My epitaph will be, he gave a good diarrhea lecture. But one of my former students is now on faculty with LSU, and he's up at Our Lady of the Lake Hospital. He says, Dr. Cassidy, he still calls me Dr. Cassidy, we got to get together. We have gone to LSU, and we have created an AI model to predict sepsis. But CMS regulations are not allowing us to implement the way that it should be. Now, there's a lot in that story. But the first thing to say is, a hospital in Louisiana partnering with Louisiana physicians came up with an AI model to decrease death from sepsis in a cost-effective way. And the implications of that, of course, is that if you've got such an AI model, you license it and you begin to sell it to other people. And so it becomes an economic engine, not just saving patients, lowering costs, but an economic engine in our state that is then exported to other states and brings revenue back to us. Started with a university with Louisiana physicians. By the way, I bleed purple and gold, but I also bleed green. I got my 100-year anniversary pin for SLU on here. So, and for the, yeah, thank you. And in my younger days, I wouldn't have said it, but I also like will now let out a go wave. So anyway, roll wave. I got to get that down. So for the greenies in here. So the second part of that story is that he said the problem is the CMS regulations aren't working for us. And that comes up with the partnership. So I called up CMS and I said, listen, you've put out this regulation. It's not really working in the way you wish it to work. People are having to do too many tests. And when they do too many tests, it actually drives up costs and it can actually harm patients. And so the folks from LSU Med School connected with the folks at CMS. They said, my gosh, CMS was so helpful. And you never hear that. CMS was so helpful. I mean, Jim Tucker, have you ever heard those words before? Yeah. Pete November, have you ever heard CMS is so helpful? I never hear that. Joan, no. So CMS was so helpful, and they adapted the regulations so that based upon the data that have been brought from Louisiana to them as to how to do it better. Now we've taken what we're doing to a different level. It doesn't just help the patient and her family to survive a terrible episode. It doesn't just help our state in terms of economic development as we take something which is positive and sell it around the nation. It helps the nation because CMS regulations informed by our experience here is now going to be better adapted whether you're in Baton Rouge, New Orleans, North Shore, New York City, Salt Lake City, Los Angeles, you name it. Those regulations will work better because of what we've learned here. There is all kinds of potential for that. Because we in Louisiana sometimes say, oh my gosh, we're 50th. Well, if you're doing healthcare, that means you've got a world of opportunity to do things better. And when you do things better, you take that model and you make our state better, but you export it across the nation. And I would say that is the opportunity before us. I would also say that is our responsibility. That is our responsibility. Because Joan has a responsibility not just to the people who go to her hospital, but to everyone who could be influenced by them learning how to do it better and exporting that. We're doing workforce development right now, and I had a great conversation with Joan and her assistant. I can say the same thing about Ochsner. Ochsner came up and testified before the committee that I'll be a chair of how do we make workforce development work for the provider, but also work for the person. When I was at Earl K. Long Hospital, one of the old charity hospital systems, there was a nurse who there was a woman who started off as a nurse's assistant, a single mom. Her nickname was Olive. And so Olive went back to school and became an LPN. And she went back to school and she got her certificate RN. And she went back to school and she got her BS. And she went back to school and got her master's. And she ended up in the clinic in which she was the nurse's assistant, being the nurse manager. Now there is something there. There is something about showing her children the power of delayed gratification and education to elevate a person. It's something about our workforce in which we need RNs, in which we, if you will, as an educational system, developed from within somebody that had that capability to take on increased responsibility. And as she did so, providing better service. And then lastly, there's the patient. A nurse assistant is fantastic. An RN is even better. And a nurse manager, you got it there. So when I look at Joan, who is working with y'all in terms of economic, and I think Southeastern, in terms of how do you do more nurse training on the North Shore, and Pete November, in which they came and testified how they've gone down to Delgado. A friend of mine used to call it Delgadoo, but anyway. Went down to Delgado and now Loyola, in which they are guaranteeing people jobs when they come out, so that not only are kids encouraged to go into the nurse assistant program or to the LPN or to the RN program, but they're guaranteed a job when they get out. We are creating a pipeline of economic development, of meeting workforce shortage, of better patient care. I could keep going on. I applaud you for your meeting. I applaud you for your meeting because you've got a responsibility to the patients. You've got a responsibility to our region, our state, and our nation. And as you fulfill that responsibility, incredibly good things happen. And I will finish by saying this. I have learned so much from you. I just talked to Pete as we were walking in. We're doing something called site neutrality, something which gets all the hospital executives a little bit nervous about me. And I said, no, Pete, I've learned from our conversations. And when you see this, you're going to feel okay with it.
And as we, now I'm not committing him, but I'm just saying, but my responsibility is to listen to you. And if I listen to you and take your collective wisdom and channel it into the public policy, if we have that partnership, there's no limit to what we can do. And then whether you're a Republican or a Democrat, you can agree with Mimi and me. This is a time for us all to be excited. Thank you.
Thank you so much, Senator. And as you all heard, we not only have a leader, but we also have a listener. And, you know, when we look at where the impact is happening in our communities, within our organizations, to see that attitude and support, that critical policy development comes from where the mission is impacting those we serve the closest is extremely inspirational. So I want to thank you. Would like to take a moment to recognize a few elected officials who are in attendance today and ask that they stand to be recognized. Our parish president, Mike Cooper. Our former parish president, Kevin Davis. Where's Kevin? Saw him earlier. Thank you, Kevin. Yeah. Senator Patrick McMath. Senator. Representative John Weibel, Washington Parish. Saw him earlier. No. And then if I could ask our members of our St. Tammany Parish Council, please stand and be recognized. And thank you for your leadership. Absolutely. We have our school superintendent, Frank Jabby, and his team. Frankie, where are you? Kathy Stewart, representing Senator Cassidy's office. Kathy. All right. And Caroline Terrio, representing Senator Kennedy's office. And Sean Hanscom as well. Sorry, Sean, I see you out there with Senator Cassidy's office. So thank you all so much for your leadership and support in making today's event possible. Today's event, presented by Ochsner Health, brings together healthcare leaders and industry innovators to explore the intersection of healthcare, innovation, and economic development in the region. With over 17,000 residents employed in healthcare and the sector contributing significant to the local economy, the event will highlight the existing collaborations and partnerships fueling the industry and exploring the future opportunities that lie ahead for all of us. In my capacities as both a higher education leader and board president of St. Tammany Corporation, I can definitely say that the healthcare industry on the North Shore directly engages their education and economic development partners across the region to solve workforce and talent development challenges, create opportunities for career exploration, partner with other business leaders to support the vitality of their workforce, and support community and nonprofit organizations working to fill gaps so our neighbors can thrive. I'd be remiss if I didn't acknowledge, all of us in this room know that the North Shore is one of the fastest growing regions in the state of Louisiana. I just want to let you know that both Southeastern and North Shore Technical Community College, your post-secondary partners, just posted the largest enrollment increases in higher ed in the state of Louisiana. And I want to commend Dr. Carlson and his team who are here today, and our team from Southeastern. This work, as you all know, could not be possible without ensuring that our graduates have places to work and grow and build families, build communities, and build our economies throughout the North Shore. The Senator mentioned our 100-year anniversary at Southeastern. Established in 1925, we will celebrate 100 years. So today we sit at 99 years and we've awarded 95,000 college degrees in 99 years. I want you to know within the last 3 decades, 10,000 of those degrees have represented nursing and healthcare. And so we're very proud of that accomplishment and our continued collaborations to strengthen our area. One initiative that exemplifies the ethos is North Shore Healthscape, a collaborative enhancing the pulse of our regional healthcare economy. This is a critical collaboration essential to not only the success of our our higher ed system, but also our K through 12 as we build essential career pathways to healthcare. This 3-parish initiative inclusive of St. Tammany, Tangipahoa, and Washington parishes, is led by St. Tammany Corporation and sustained by a steering committee led by the executive leadership of Ochsner North Shore, Mississippi Gulf Coast, St. Tammany Health System, Slidell Memorial Hospital, Lakeview Hospital, North Oaks Health System, and Our Lady of the Angels, in collaboration with North Shore Technical Community College, Tri-Parish Works, and Southeastern Louisiana University. The current focus areas of North Shore Healthscape include workforce and talent development, regional coalition building, research and analysis. A key outcome of the research and analysis focus area was the commissioning of the State of the Sector report on the healthcare industry on the North Shore by the North Shore Healthscape Steering Committee. To report on these findings and give you all a sneak peek, the official report, before it's released next month, the official report will be presented by Skylar Casey, Director of Research and Economic Leadership. Economic leadership may sound familiar to many of you in the room. It is led by Ted Abernathy, who's no stranger to our region. Economic leadership is produced by the Economic Impact Analysis. It produced that analysis, which informed the building of St. Tammany Corporation's Thrive 2023 strategic plan. Ted was also a featured speaker at Southeastern's College of Business Executive Business Forum this past spring, providing an economic overview of the region. So please join me in a warm welcome for Skylar.
Thank you. All right. Make sure we got the mic working. Sounds good. And I'm going to make sure this works. Look at that. Amazing. Awesome. Thank you, everyone. I'm Skylar Casey. Like my introduction said, I work with Economic Leadership, Head of Research. So I was the one deep in the numbers of this report that'll be coming out in a month. And I work for Ted Abernathy. And he couldn't be here today, but he texted me, he said, so, tell all my St. Tammany friends hi for me. So if you know Ted, he says hi. And just a little bit about our company. I've been with Ted since he founded it in 2013, and we're working almost all over the country now. We do locational analysis, economic impact analysis, and we mostly just help economic developers figure out what's going on in their region and how they can be strategic. We've been fortunate enough to work with a lot of great places, including Lobby. St. Tammany Corp's been a long time client of ours. I was back here in 2018 talking to some of you about workforce for that plan that they mentioned, and we were talking about all the workforce struggles, and good thing we figured that out, right? It's so much better. No, we'll be talking a lot about that. But most of you don't know me, and so I wanted to kind of set the tone of our talk. As an economist, sometimes I talk about industries I don't have a ton of experience in or don't know much about on the ground level. I only know kind of the economic side of it. But I was really excited to talk about healthcare. This is an industry that's meant a lot to my family. In that corner there is my mom. She grew up in downtown Baltimore, was the first woman in her lineage to get higher education. She started off as a lab technician, and then she got into the business side, got an MBA, and she worked 20 years for a group purchasing organization and was always traveling to hospitals and working with many of you, I'm sure. And her sister, that's my aunt in the bottom, with her daughter, and they are all PTs, and that's them at the PT conference. And then on the scooter on the right is my sister. She has to scooter into her hospital in Charleston, South Carolina, because parking's pretty tricky, but she's a PA. She also took the torch of getting into the healthcare industry, and she's been working in the hospital for 10 years. How many providers do we have here today? Raise your hands high. We've got a couple, yeah. Let's give it up for our providers. If it's anything like my family, the providers are doing their regular job, but then they're also the in-house physician or nurse of their family, and you're getting text about any weird coughs, or you do a lot off duty as well, so thank you. But when I thought about this presentation, when I thought about the economic impact of healthcare, I thought about how the healthcare industry has created wealth, generational wealth in my family, and economic security for many of my family members. And I'm sure all of you have similar stories and have seen that as well for your employees as they move up the ranks. So just wanted to frame all the numbers and statistics I'll talk about with that. So I'll be talking about this report. It'll be coming out in the next month. I'm going to have a lot of charts. If you can't see everything, I'll be talking through each chart, so don't worry. When you're talking about an industry, you want to make sure you're talking about we're all on the same page. So we defined healthcare with 37 specific NAICS codes. That's the government standardized codes. And we mostly focused on ambulatory healthcare, hospitals, nursing, and pharmacies. And we'll break the data into those 4 sectors. But that's kind of the framework we're working with here. And all that will be in the report if you want to get really nerdy with it. And the report was for the entire North Shore. I know we're in St. Tammany today, but just want to mention the data's for the entire region. In the report, we break things out by parish. Obviously, as this map shows, St. Tammany is a big part of all of that. All right, and when we looked at the data, we noticed the huge impact and put numbers to that impact of the healthcare sector. Over 26,000 employees are in the region, for over 1,400 establishments. That's a place with a payroll. And then when you look at wages, over $2 billion in wages going to all your employees. And when you look at that impact compared to the total economy of the North Shore, we're looking at 16% of all employees and all wages. We also looked at taxes and exports and GDP. GDP is also a very impressive contribution at 11%. When we look at how things are going over time, we got real GDP, establishments, and employment all trending up. You've experienced this growth. You know this. Particularly establishments have been growing up pretty strongly. All right, so this next couple of slides compare healthcare to the other industries in the North Shore. And it just gives you a real sense of how much of a driver the industry is. When we look at healthcare, it's the #1 contributor to GDP. It's also the #1 contributor to employment in the region. Obviously, retail trade, food services, education, also a big component, but healthcare is #1. And when we look at growth since before the pandemic to now, it's been a huge driver of the growth in jobs. There's been other growth in the region as well. That's been pretty strong, but nothing quite like the healthcare sector. When we look at average earnings, healthcare is kind of in the middle there. I think I'll talk a little bit about this, but we have a bifurcation in the healthcare sector where there's some really, really high wages and some lower paid positions as well. So I think it kind of ends up in the middle there, but still a higher average wage than many other sectors in the region. When we look at those wages kind of compared to other places and adjust for cost of living, which any potential employee will do as well, wages in the North Shore are comparable to the rest of the state. The national average indicates that there are some other places where people could earn higher wages, and so your potential candidates might be weighing that when they're making their employment decisions. When I talked about those 4 kind of subsectors, we dive into that. You see most of the jobs are in ambulatory healthcare and hospitals, and you've seen significant growth over the last couple of years in that. Hospitals also offer the highest wages in the area. And when we compare that growth with the national averages, you see that the North Shore is doing better, way better than the national average in healthcare, ambulatory healthcare and hospitals. And then we've seen a national decline in jobs in the nursing and residential care sector, as well as that pharmacy and support services sector. But the North Shore hasn't been declining as rapidly as the rest of the country. So that's kind of the general overview of how big and how strong the healthcare sector is. And now I want to talk about how we measure the impact of a sector. So there's a couple of ways we measure in economics the impact of something. That can be the wages an employee has, and then they go and spend that in their economy. They go and get their beignets, or they go to the doctor themselves, right? It keeps rippling through the economy. There's also your suppliers. If you're utilizing local suppliers, you are kind of rippling your impacts and supporting other jobs in the economy. And so as economists, we try and measure that, and we do all these complicated analysis to get a number of what is your job impact. And this comes out to, like, if you add one job, you'll add this many other jobs throughout the economy. And when we look at that multiplier for healthcare, it's again kind of in the middle, but higher than many other sectors. Not quite as extraction and government, but I think that's a factor of those average wages that we talked about earlier. But we can apply that multiplier to the number of healthcare jobs we already know. And so the initial jobs are 16% of the economy, and then when you factor in that ripple effect, you get a whole nother 10% of the economy that you're supporting. And now I'm going to talk about workforce, because I know that's a huge issue, and it's a huge issue all around the country and in every industry, just because we're going through demographic shifts that make it very challenging. And so we'll talk a little bit about your current workforce and where things might go. This is job postings in the North Shore for healthcare over time. You had a big kind of reopening of the economy boost in 2021, 22. That's going to come down a little bit, but it's still higher than levels you've been previously used to, so it shows the demand is high. When we look at the top occupations that keep this sector running, there's 3 nursing categories that are in the top jobs. And then you also have your receptionists and your office clerks that keep everything running. Those are also very important. Those are your top jobs and probably the ones you have a hard time filling. When we look at which occupations are growing the most in the sector over the last couple of years, home health aides is a growing portion. Janitors and cleaners. I've talked with several of hospital management who say, that's a huge one that can have a huge impact. Obviously, like, we know how important it is to keep everything sanitary and clean in a hospital. And then substance abuse, mental health, we're seeing that go up across the country as we try and get more care for everyone. And then when you look at percentage growth, you see also a rise in therapists as well. Healthcare, we talked about that kind of bifurcated workforce, so I split that into 2. You have healthcare support, those are your kind of nursing assistants, a lot of your assistant and technician jobs. And then we've got the practitioners. Practitioners tend to, once they find a good gig, they tend to stay there. Healthcare support, that other side of the coin, they tend to have some of the higher turnover rates. And healthcare practitioners was going up for a while as far as turning over and churning into different jobs. But I think after everybody kind of made their move post-COVID and is kind of settling in. But healthcare support keeps going up, and that's going to be a challenge for all of you. I like this meme about statistics be like, yeah, this may or may not happen. It's right, so helpful, right? So I will give that caveat. We don't know the future, but we have several trends that we feel pretty confident are coming down the pipeline, and I'll talk about how that might impact your business. We can kind of predict jobs out into the future the best we can, and based on past growth, the kind of right dotted lines on the right are the 10-year projections, and North Shore's in blue there. So you've been growing faster than the state, faster than the US, and that's projected to continue. One of the things we wanted to, St. Tammany Court asked us to look at was remote health jobs and telehealth jobs, and we looked at that and saw some trends in the job postings. You did have this big spike, but things have kind of leveled out a little bit. When you look at, back before the pandemic in the North Shore, only 1% of jobs in healthcare were remote or telehealth, and that's up to 3 now. So things shifted, and most of those have leveled out. Like whatever's going to be telehealth has kind of settled into that. We know population change is a big key factor for your demand for your services, as well as the size of your workforce pool. And St. Tammany's population is going to grow the fastest in the North Shore region. And the North Shore is going to grow faster than the United States and Louisiana. I think one thing to consider looking at these trends is for the future, over the next 10 years, is what's it going to be like to be in an area that's growing fast in a state that might be losing people? Is that going to mean more rural clinics and hospitals are closing and more people are coming in here? I think that's going to be a big thing to consider as you look to the future. One trend we know is happening is our population is getting older. That's going to create demand in some of your services, but it's also going to make the workforce equation more challenging. We know there's been more retirements in the last couple of years than there's ever been before. So you're going to need to replace all that institutional knowledge if people are retiring, and healthcare support jobs and healthcare practitioner jobs in the region have some of the higher rates of older workers. And we can take all these numbers on turnover, retirement rate, and we can kind of get an estimate of how many jobs you need to hire every year to keep up with growth and people moving out of the region and stuff. And so this is that chart: home health aides, nursing assistants, RNs. Those are going to be huge needs, as well as therapists and mental health counselors. So I took that chart I just showed you, put that on the left. The chart on the right is all the health education that comes out of your post-secondary education institutions. This includes certificates, degrees, everything. And I put them on the same axis so we could kind of do a little comparison here. And as you can see, there's not quite enough. I know all of you, I know we have some institutions here today. I know you and the senator spoke on all that's being done to do that, but there's going to be more than just sending people to school. You're going to also have to probably do some recruitment outside of the region, try and find ways to bring people in. And one of the things we noticed in the trends was healthcare completions had been going down, but then in the most recent year of data, it went back up. So hopefully that keeps trending back up for all of you. And then we can look at people's LinkedIn posts and profiles and figure out where they went to school and where they are now. And so people who went to school in the North Shore for healthcare often end up in Baton Rouge, New Orleans, but there are some of your cities here in St. Tammany and the North Shore region as well. But keeping people connected to the place, getting people internships here locally is going to help you improve those numbers. And I really like what the senator said about how it's kind of, healthcare is one of the few industries where we still have that kind of started in the mailroom potential of where you can get an entry-level job and keep going back to school and keep going back to school while you're working and keep moving up and building that economic security. So I think that'll be a key when we're looking at the future of this industry, is how do we keep supporting people? What are the wraparound services people need to, you might have education benefits, but what are the other supports that people need to be able to utilize them? I was talking to someone from a hospital in a different region, and she said they had all these programs and no one was utilizing, and then they started working on the wraparound care, the child care, the transportation, and for one employee, the barrier that they were able to fix so easy was like he didn't have the right pair of shoes. He just was worried and all they had to do was give him that support, and then he got into the program. He felt confident that he could do it, and continued his education. So there's a lot of opportunity to continue. I'm sure workforce is going to be a big topic. AI will be a big topic. And so I hope this provided you some context and something to talk about while you're having your conversations here today. I'll be around. I think we're going to keep the presentation moving. But if you have questions, come find me. And I'm happy to talk nerdy data with you any moment. And then look forward to the report in the next month from St. Tammany Corps. Okay, thank you.
Good morning. My name is Ashley Llewellyn, and I'm the Vice President here at St. Tammany Corporation. We're so glad to have you with us this morning. As my fellow panelists are coming on up, I'm going to have you all come on up and grab a seat. I do just want to share a few housekeeping notes. Please know that the doors over here, where you were able to grab breakfast and coffee, are available to you all day. There are snacks and food kind of coming out throughout the day. I think we can all agree here that we will not take personal offense. If you get up to go refill your coffee, grab a water, grab a bite to eat, this is truly your time and your experience. So please, please, please take full advantage of all of the refreshments. And as a note, the restrooms are out to the main lobby and a little bit to your left. Again, this is your time. We want you to be comfortable. But we're excited to dive into this next conversation, and Skylar handed that over beautifully. Really talking about the value of collaboration and partnerships and how that is explored and experienced here on the North Shore. So we're going to take a moment, and I'm going to have our panelists introduce themselves. Dr. Wainwright, we're going to start with you and roll on down the row.
William Wainwright, President, Southeastern Louisiana University.
Good morning. Jim Carlson, Chancellor, North Shore Technical Community College.
Matthew Block, I'm the Chief Administrative Officer at Ochsner.
Ann Pavlovich, St. Tammany Health System.
Hey, good morning. I'm Ben Risho. I'm the CEO at Lakeview Hospital here in Covington.
Excellent. Well, collaboration and partnership really are the cornerstone themes of today's conversation, and you're really going to see a through line of how we are working together in various capacities to really establish pathways to prosperity for our local community members. We're going to talk a little bit about workforce, a lot about community-based health outcomes, but truly about how the collective is far more impactful than any one individual. And so, Matthew, I'm going to kind of turn this over to you. I'm going to come to you first to really kind of share what is the value of real collaboration and partnership?
Well, thank you, Ashley. First off, it's exciting to be here with all of you this morning. I think this room and the panels you're going to see today are a demonstration of the answer to that question, because at the end of the day, it's a force multiplier, because whether it's the partnership with the other health systems that we have in this parish with Slidell Memorial and St. Tammany, or whether it's the partnerships we have with Southeastern and North Shore and with Dr. Carlson, Dr. Wainwright here, it's I know we're going to talk a lot about workforce development here today, but the truth is we have seen, particularly in the last 4 years, such a dramatic need for more education, more development of our future workforce. Those things do not happen without the partnerships that we're able to develop. And part of it too is the external partnerships that we're able to bring that are going to provide additional access and quality care, like the partnership we have with MD Anderson that is bringing in world-class cancer care into St. Tammany Parish. So I think all of those things, and of course, I think one of the things that we all need to focus more on is even earlier partnerships. So working with the school systems, for example. Ronnie Simpson talked to me yesterday about it's like planting an acorn of developing not only those clinical jobs at an early age, but talking about all the different things outside of even clinical care for those job opportunities which are going to come later in life. So I think all of those things are things that we are focusing on as demonstrated by today, and that we need to double down on.
Absolutely. We often say that your healthcare institutions are really kind of a microcosm of what happens in any city and community. The variety of occupations that are housed within your individual organizations present beautiful opportunities, but also challenges that come with that. You're talking to so many different people and so many different perspectives. And so, Dr. Wainwright and Dr. Carlson, I'm going to kind of toss this over to you all in tandem. We've been talking about pathways to prosperity for a good long time now, and you both have established such a beautiful career trajectory here on the North Shore, really connecting people, individuals to opportunities. And so I'd love for you to share with us kind of what's happening right now on your campus. What are you all doing and what are your teams doing to really support that pathway development? And don't be humble. There's a lot of cool accolades. I won't steal your thunder, but please don't be humble.
Thank you, Ashley. So for NTCC, we try to do the best we can to help people where they are and help them get to where they want to go. And a lot of times that might mean something as simple as one-day training to be CPR certified or how to drive a forklift, or it could mean going all the way to a 2-year associate's degree and become a registered nurse. The trajectory for us often starts with the high school because at NTCC we are the largest provider of dual enrollment of the LCTCS colleges. And we have a little bit over 2,800 students currently this fall who are participating in dual enrollment. And for us, we try to reach them at a younger age so they can begin to explore what their opportunities might be. In many ways, that ties to a lot of the healthcare opportunities. And kudos to Christy Marceau and my team over there. Christy's our Dean of Health Sciences and Nursing, but her team created a program that was the first in the state, which is what we call a pre-nursing program in high school. And students can pursue this their junior year, and after their junior and senior year, they earn essentially their first semester of practical nursing while they're in high school, graduate from high school, then they come to the college, and within 1 year, they become a practical nurse. So those are the things that we try to do to reach people. Once they go to work and get a little experience, they'll be able to come back in the near future and then do our LPN to RN bridge, which will kick off hopefully as soon as next year. We got our very first registered nursing program at NTCC that are currently taking classes, and they will graduate in May. So that's a big change for us in terms of reaching a different group of students who want to earn that particular licensure. But it's also a great opportunity because we've been serving, Dr. Wainwright can answer this better than I can, LPNs for 50, 60 years. So we have a huge population of practical nurses that want to make that next jump over to the RN at the associate's degree level. So we're going to begin doing that in the very near future.
Yes, and Senator Cassidy talked earlier about that continuum of learning and ensuring that we've got the infrastructure in place to continue to bridge individuals as they continue through the healthcare spectrum. I do want to share with you the college prep dual enrollment, as we call it in high school. We talked about enrollment. I mentioned during my remarks about North Shore and Southeastern being the fastest growing. Our dual enrollment is matching that. Our numbers came in at 3,600 dually enrolled students here on the North Shore. That's an incredible opportunity for not only individuals in high schools to get acquainted with a sector, get familiar with it, but also saving dollars for families in ensuring that those credits transfer, and we've got a very strong partnership between our two institutions to move people. And so many of our graduates at Southeastern do come right out of high school, but many come to us through continued bridge programs through our College of Nursing and Health Sciences. And what I love about the work that we're doing is when we benefit from transfer students from North Shore to Southeastern, or a student directly from high school who has taken healthcare-related dual enrollment to Southeastern, we not only have a better prepared student, the data shows that we retain them and we graduate them stronger than we do a traditional student who is not dually enrolled. St. Tammany is poised for a huge opportunity for continued investment in K-12 infrastructure specific to healthcare. And so if I could make a bold request, I'd ask each and every one of you, if you have a relationship with a school board member, let them know how important high school dual enrollment is specific to healthcare, and to make sure that we don't miss any opportunities and continue to maximize support to build out infrastructure to support one of our fastest growing sectors we know here on the North Shore.
Excellent. And Ben, for you, this is really deeply personal when thinking about that pathway to prosperity. You're a local native, coming back to run that microcosm. Talk to us about that experience of coming back home in that capacity and what it's meant for Lakeview Hospital to really join in under your leadership to these real collaborative endeavors.
Yeah, fantastic. Thank you. So I'm a native. I was born and raised on the North Shore here. My healthcare journey has taken me across the Southeast. So the first thought that kind of comes to mind as we sit here, you know, I've been in markets in Alabama, in Tennessee, Mississippi, Texas. We have a very healthy ecosystem, and I think that's so reflective of the conversation and the dialogue that's taken place today. Because again, that health comes from a willingness to have conversation, a willingness for the community to come together in such a coordinated fashion through multiple of different avenues, again, to deliver improved access, better quality, everything that you talked about of why it's important. You know, for LCMC, when I had the opportunity to come back home, which was a big deal, as you mentioned, personally for me, the thing that excited me so much in the conversation that I got to have with our partners, again, at LCMC, was their commitment to the North Shore and their commitment to the region of Louisiana. You know, Lakeview for years and years has delivered really, really high quality care that's commendable. However, if you kind of sit back and from my vantage point, what's the one little small piece that perhaps was missing? And it was that really integrated and fine-tuned collaboration and partnership with the efforts of the North Shore community. So for me to be here, again, having come home, to be able to work at an organization that is firing on all cylinders, that is delivering high-quality care, but then have that partner in LCMC, again, that is willing to fund, that is willing to make the investment, that is willing to partner in and contribute and be part of all these great efforts. It's a wonderful opportunity for me to be here today.
Well, and you've really set a strong strategic direction for you and your team of how to do that and really wanting to engage. And we've had a lot of kind of conversations amongst all of us that strategic direction, that intentionality is so important in determining not only where we're going, but how we're going to get there and who needs to be at the table. And a real critical conversation that we all have had over the years is trying to be a good steward of asking the question, who is missing from this conversation? Who is not at the table? And how do we go out and find that person, that individual, that organization, and really loop them in? And Anne, so much of the work that you're doing through Healthier North Shore is exactly that. Share with us about the work that you're doing through Healthier North Shore and on behalf of St. Tammany Health System as well.
So Healthier North Shore, I've heard time and time this morning, collaboration. And that's really a resounding theme in what we're trying to accomplish with Healthier North Shore. It's kind of the heart of the initiative, and so I'm really proud to be a part of it and proud to look out and see a lot of the partners that are at that table with us time and time again as we continue to move through this journey. But we started Healthier North Shore in 2020 and wanted to partner with healthcare, government, our nonprofit organizations here in St. Tammany and Washington Parish. We're so fortunate we have such a wealth of those organizations here, but really wanted to partner to improve our health outcomes and improve the health of our residents. And so we set forth that mission and created committees. I've got so many familiar faces in the room that work with me on that every day. And so I'm very grateful for that. But something that we've done recently that I'm really excited about is a partnership and really a deepening of that relationship of all of our system partners is our community health needs assessment. And so in January of this year, we decided that all of the healthcare entities that are part of Healthier North Shore undertook a community health needs assessment through the Louisiana Public Health Institute with the help of United Way to go through this process with us, help us identify what those really pressing needs, those social determinants of health, things that are really impacting our residents, and identify what those most key priorities are, what are our focus points going to be, and collectively, all of the health systems and hospitals that are a part of Healthier North Shore are going to work towards improving those strategically going forward. And so we're really excited. Next week, actually, we solidify those priorities. We have an executive committee meeting, so Dr. Rydell, I'll see you there. We'll set that agenda and then develop going forward our CHIP, which is, I know it's, acronym speak, but it's a community health implementation plan. So more importantly to me, I think everyone that's in healthcare kind of understands what those pressing needs might be, but what are we going to do about it? How can we put action behind this report and make a difference going forward? So this will be the driving force, the roadmap, really what we're trying to aim to improve for the next 3 years with the initiative.
Absolutely, and those community health outcomes and that action plan, so often we look around and say, well, yes, now we have the data, and so what? So what do we do about it? And I think that, when we think about partnerships, we really think about how business and industry has partnered with, especially higher ed, to come to the table to say, this is my challenge, my opportunity. How do we together solve? And so Dr. Carlson and Dr. Wainwright, if you could share about some of the unique partnerships that you all have with business and industry, where business and industry has worked alongside you and your colleagues to truly build programs from the ground up, truly that back of the napkin, what about, could we?
Yeah, without a doubt. And for us, when I was at North Shore Technical Community College as chancellor at the time during COVID, that's where it really illuminated a lot of the importance and urgency and made us look at programs differently. And what I appreciate of the support of Ochsner at the time was they engaged quickly to look at some compression of training and workforce development with the understanding that ending credential culminates in a pathway to continued and future growth. And once we accomplished that, in working with Ochsner, we then scaled it across the entire North Shore with St. Tammany Health System, North Oaks, Our Lady of the Angels. And that has been extremely helpful, and vice versa. We'll work right now. Joan and her team at St. Tammany Health System came to Dr. Carlson and I and our team members to talk about an access point for the parish, which was critical, and which led to the establishment of complements of St. Tammany Health System, the St. Tammany Advanced Campus, which is located in Covington, where we are jointly there with sharing faculty, students, and resources to support continued learning. And also, we're fortunate with our healthcare partners because in addition to traditional healthcare careers that we're all very familiar with, we're also engaging with our employer partners on AI. We're engaging with them on cyber. We're talking about all the other degrees that we both offer collectively, IT, looking at the two-year system, and Jim can touch on it, just the day-to-day maintenance of our institutions. We are an incredible workforce resource beyond just traditional healthcare careers, and I'm excited that our partners have all embraced that and have come to us to continue to bolster those programs of study.
Yeah, and I want to add really just two things to the conversation you started was in 2019 we had our very first MA Now program with Ochsner, and this was before we even knew what COVID was. And this was an opportunity to take people off the street and become a medical assistant, but before they selected the group that were going to go through this compressed training, they had to be interviewed, and it was a selection process. And then the goal was once they completed the program, they would be then placed in one of the medical facilities by Ochsner on the North Shore. So we had that program, and it went very well. But just recently I learned, actually a week or maybe 2 weeks ago now, we had a student that participated in that program. And she, during the process of earning her medical assistant program, we learned that she was homeless. And we stepped in and connected with Tri-Parish Works as well as Family Promise. She got some temporary housing to start with, and then they got more permanent housing for her. She ultimately completed the medical assistant program, went to work for Ochsner, and then she recently went through the MA to LPN Bridge program with NTCC that Ochsner supported her for throughout the entire program. She graduated. She's an LPN now on the North Shore, and she's absolutely flourishing, not only to the point that she's doing well at Ochsner, but she was featured at their annual meeting just recently, and she told her story. And that's what this is all about. I mean, our job here is to not just provide quality health care close to home, but help people help themselves, and then in return, they can help you. And I found out from this recent scenario that she now wants to do our RN Bridge program once we kick that off next year. So that's exciting. That's really what we're trying to do as a community college and a university. The second thing I wanted to mention was the partnership we have with all of the healthcare facilities to do a new program. It's the first in the nation, but it's called Maintenance Facility Technician. And it's specifically for maintenance workers and healthcare facilities technician. Get it right. But we partnered with ASHE, which is the National Association for Healthcare Engineers, and they created a program that they're going to replicate not just here statewide, but also throughout the nation. And it is to prepare people specifically for the maintenance roles of a healthcare facility, which is completely different than than a office building or a hotel or some other large facility. So that is something that we're very excited about. And I want kudos to North Oaks. They're actually allowing us to use their facility as their lab experience during the 16 weeks program. But right now we have 12 participants, two individuals from a variety of the different healthcare systems that are participating. And then from there, once we get through the very first cohort, we're going to open it up to the general public for people who want to get into the industry.
Excellent. And so much, though, I think one of the things that I've learned from you all has also been about the policy and the regulation that goes into when you're scaling a new program in response to business and industry and kind of co-creating that experience. There are also additional factors to consider when kind of preparing for those things. What is the course ratio? What is the qualification of the instructor? Yes, sometimes facilities themselves are a challenge, but often it's, do we have the right people in the right seats to create additional opportunities? And so, Matthew, I'd love for you to kind of share from your perspective. The legislative session is in session right now, so a very timely topic. Share with us about kind of what's happening in the current session that might be really relevant to the healthcare sector, but also what are some of those things with the other regulatory boards where we can really be advocates for the advancement of healthcare opportunities in our region?
Sure, I'm happy to, and I know we have Senator McMath here today with us, and they have a challenging couple of weeks ahead to figure out, because I think the whole idea behind this is we do have a antiquated and really complex tax structure in Louisiana, and in this session is an effort to tackle it, to really streamline it and make it where it's much more efficient and much more attractive for businesses around the country to be able to come here, because you do hear frequently when businesses are trying to come here, they try and figure out our sales tax structure, which is different parish to parish and very complicated, and so the idea behind it, if successful, what it would do is make Louisiana a much more attractive place to come in and do business. And it's an exciting opportunity for all employers, whether you're healthcare or not, to be able to come in and really transform not just how we work in Louisiana, but the image of Louisiana to outside companies wanting to come in. And I think to the second part of your question about regulatory reform, et cetera, I think we see the same sort of thing, that sometimes sometimes it's well-deserved, sometimes maybe it's a bit unfair, but the perception is that we make it really hard to do business in Louisiana. And whether it's on the healthcare side or industry side, whatever it may be, we need to change those perceptions and really try and make a big effort to streamline things, and that's what this session is all about. And so, it's something to pay very close attention to, because there's significant changes, whether you're in the healthcare sector and you're looking at how they're going to tax pharmaceutical medications, or moving the ad valorem tax exemptions that are in the Constitution to statute. Those things which could have significant impact on all of us, and thankfully the legislative stakeholders, the governor's office, they've been working very closely with all of us, I'm sure many of the same people in this room, to really understand what the impact is going to be, work through those problems because it is complicated, and you push in one place and you have to pull in the other. But I think it's an exciting opportunity, and it's certainly something we all have to pay close attention to over the next week and a half or so.
Absolutely. And kind of thinking about that kind of opportunity for transformational change and really thinking outside of the box and being creative. When we talk about community health outcomes, we're looking at that chip. When we're thinking about strategic direction, what is kind of one thing that, as you're kind of going through this initial data, you don't have to give away any spoilers, or kind of setting that strategic direction among some of our partnerships, what is kind of that one thing that if you could say, this is the one thing I would love to eliminate, put at the forefront for conversation and discussion, what would that be for both of you?
Well, I'll start. I guess for me, the one thing, maybe a word, and that's momentum. You know, I had mentioned at the onset of the conversation, you know, Lakeview's in a time of transition, wonderful transition. You know, we went from a really prominent partner in a national for-profit organization to now a local regional Louisiana partner. You know, a partner, LCMC, Louisiana Children's Medical Center, that came out of the culture and identity of this state and of this area. So for us, you know, that change and that transformation, that's a new cultural identity. So we are prepared and excited about maintaining the momentum, maintaining and continuing to encourage this dialogue. And we're really excited, you know, just as an example, we have academic affiliations with both Tulane and LSU, one of the only systems in the country that has 2 academic affiliations. So I can tell you with LCMC's involvement and the local leadership at Lakeview, the dialogue that has come out of those conversations has just been so promising and so wonderful for the community about what that can fulfill and entail. So it's taking what comes out of these initiatives in terms of being able to understand your strategy, understand the ecosystem, understand the community needs. How do you fit as an organization? What is your identity? Where are you on your journey? And then how can you put your piece into the puzzle?
And I'm going to play off of that. I think momentum is a perfect way to describe what we're doing with Healthier North Shore. Really identifying what we can do and then strategically place those things with partnerships, you know, like whether it's vaping education that we're doing with public schools or community gardens and nutritional programs that we're doing with NAMI St. Tammany and the American Heart Association, parlaying all of those incremental things into one positive direction, I think is really going to be something that we'll see in the next few years of building that momentum and driving forward as we continue to improve.
Absolutely. Now, I do want to be respectful of everybody's time, but I want to I think this is an important moment, all of us together in this room, to really make sure that we are aware of what our partners on this stage are kind of bringing to the table. And so when we think about kind of beginning to wrap up this conversation, I would love for each of you to be able to share what is something that your and it doesn't have to be anything super specific, but what is something that your organization is either working on now or has coming up in the next few months that you want to make sure that this audience is keeping their eye on and potentially staying in touch with you about? And then I want you to specifically tell them how can they contribute to stay in touch for that initiative. So Dr. Wainwright, I'll kick it over to you.
So I'm really excited. This one hit close to home to me because my son had to go out of state to earn a degree in medical sales. Does that surprise any of you? We have a void in Louisiana. Well, no longer. Southeastern has now been approved to offer medical sales through our College of Business, and that's a collaboration through our Dean of our College of Nursing, Dr. Caruth, who's with me, and our Dean of our College of Business, Dr. Tere Lopez, who's with us. They came together to establish that medical sales curriculum. That is now approved by the Board of Regents. We have a robust advisory board. If you have an interest in serving in that advisory board, please do not hesitate to reach out to us. We're located in the corner of the room. Reach out to Dr. Lopez, Dr. Caruth before you leave today. I am fired up. I've seen too many of our talent, specifically on the North Shore, too many of our young people that have had to leave to earn those credentials. So I'm really excited about that. If you have an interest in AI, If you have an interest in continuing certification and graduate level work in an online MBA with a focus on cyber for your organization, that exists at Southeastern. Dr. Kruth and her team are doing incredible work in simulation and also telehealth with outreach to our rural communities on the North Shore. Please touch base with Dr. Kruth. And then I'll close with this. They don't know I'm about to do this. I have a graduating senior with me. Reed, raise your hand. Reed is a kinesiology major graduating in May and wants to focus on pediatrics and physical therapy. I have Hallie with me. Hallie is a graduating RN in May and wants to focus on ICU. They'll be available to have conversations with you after.
This is a pathway to prosperity.
Pathways to prosperity. So they'll be available after the symposium.
So for North Shore Technical Community College, I would say most importantly for us over the next 3 to 6 months is really going to be focused on infrastructure. Our college has proven, thanks to Dr. Wainwright's leadership as our original chancellor, but if you build it, they will come. And if you've been to the Lacombe campus, if you've been to the Hammond campus, you've been to the Livingston campus, all along I-12, they're full. And we need more space to be able to expand to new programming to truly serve the populations we're being asked to serve. And I think the number one priority for us, as well as it's listed as the number one priority for the LCTCS system going into this session, and that is to build a new Hammond area campus. The campus we have now right by the airport is old, it's out of date, and unfortunately, it is too small to meet the needs of the people of that area. So North Oaks Hospital stepped up and they've offered us 15 acres of land next to the rehab hospital in Hammond to build a new facility that would focus on all the technical and trades that we do offer currently, plus some new things, but then to truly expand into the healthcare training sector. So if you have any influence with our representation at the state, that is very important for this, not just for the college, it's for the community, for us to be able to truly serve the people that want to get into those career fields, but also to be able to provide the career opportunities here on the North Shore where they're more likely to stay here once they finish. So I would say that's probably our biggest thing. And I do want to just mention thank you to Joan and St. Tammany Health System for providing STAC, which Dr. Wainwright had mentioned. We wouldn't be able to have the RN program if it wasn't for them because we had no place to put them. I mean, that's how much space is a premium right now. All of our RN nurses go to Covington to their facility to do that program. And it is full. We actually have to have a shuttle to drive people across the street to park at the church so they can go to class there. And that's a good thing. I'm not complaining about that. I'm just saying that just tells you the need that we have for the desire that people have to do RN nursing. But to give you a little perspective, last year we turned away probably twice as many people as we were able to admit into the RN program. And these are twice as many qualified people that met the standards to get in the program, which, yeah, it's great, right? It's competitive, but at the same time, we're turning away, 70, 80 people that could have been RNs here on the North Shore, but they may go off somewhere else and do the program and never come back. And that's a problem that we have to be able to solve.
But before I answer your question, I want to tackle into something Ian said earlier, because if you look at Skylar's slides earlier, Nate, I think the numbers are something like 15% of employment is healthcare, about 10% indirect supported by healthcare. If you think about that other 75%, the truth is they're indirectly supported by healthcare too, because if those individuals are not healthy and able to get access to care, if their kids are not, they are just as impacted by healthcare as the other 25%. And so one of the things that is going to be a theme throughout today is just being able to provide that access to quality care, because you don't have to go very far anywhere in the state to find there's some real challenges with access to care, and it's an obligation for all of us on this stage in this room to be able to improve that. You're going to hear from several of our fantastic leaders throughout the day about initiatives that we have at Ochsner. So I'll just mention one that maybe they might not mention. And even though it's not a North Shore initiative, it is a statewide, nationwide initiative that I'm happy and thrilled to be a part of with our new medical school that we're going to be working with Xavier for the Xavier Ochsner College of Medicine, that several years from now we'll be able to open in downtown New Orleans. It'll be the fifth HBCU medical school in the country because, as Skylar knows, I don't think he has any slides, but I'm sure he's very familiar with, we have a cliff coming in the number of physicians that we have in this country. A lot of them are getting to the point where they're going to be leaving the practice of medicine, and every healthcare provider in this room in the state would tell you it is a dramatic need. We need more medical students, we need more residents, we need more training programs. So that program is really exciting because it's one that we have this enormous opportunity to really change the trajectory of healthcare education in this state, to bring students from the North Shore, from all over the state, from all over the country, to come and be educated here in Louisiana and hopefully to stay here and spend their careers here. That's not only improving access to care, but that's economic development, that's additional tax base, all the things that improve our economy and our healthcare, because they are completely intertwined.
Absolutely.
I'd say for St. Tammany, we're about to celebrate our 70th anniversary of being your community hospital and your provider here in St. Tammany, the western part. And so whatever the need is in our community, I feel that our leadership finds a way to meet that need and meet our people where they are, whether that's by our new ambulatory surgery center that's going to open soon on Bootlegger Road to provide access and expanded availability for surgical care, whether that's our GME clinic that's in North Covington. We talk about pipeline and providing a way for physicians to come in and serve the need of our growing and our aging population. That's going to be critical going forward. Or things like our mobile initiatives. We have a lung cancer screening unit that we're going to launch in early 2025 that we're really excited to bring that modality out to the community, screen more people and meet them where they are. So I think that's really, St. Tammany Health System has a niche of meeting the needs of the people where they are. And we're just excited and proud to play a role in this community.
Yeah, so for Lakeview, I talked about our partnership with LCMC. The excitement is pretty overwhelming. I think about the next 5 years, and I think you're going to see just a vastly expanded and much different footprint for the campus here on the North Shore. I think you're going to see, expansion of service lines, additions of service lines, new access points. And again, that's from the local commitment, the participation and collaboration and dialogue such that's occurring today. And I couldn't be more pleased. And, just a kind of a final brag or thought when I was sitting and thinking about how to answer the question with respect to workforce and development. Just as an example, just in the fourth quarter alone, there are going to be 250 students that rotate through Lakeview in a variety of different clinical capacities and forms. So the community is doing a wonderful job of trying to attract and retain the talent that we have here, and I just applaud the efforts of everybody here today.
Excellent. Well, we could talk for a very long time about these topics, but I so appreciate your attention today and you all's continued leadership and service to your respective organizations and to St. Tammany and the North Shore as a whole. Thank you all so much for joining us. Dr. Rydell, I'll welcome you to the stage.
All right. All right, now we're ready to go. All right, so we're going to start the conversation about some of the innovative changes that are happening. My name's Tim Riddell. I am a family physician right here in the community, a Slidell native. I currently serve as the CEO for Ochsner here on the North Shore and across the Mississippi Gulf Coast. Really excited to have a great panel to talk. What are some of the tech innovations and changes that are coming, actually some already here, in healthcare? So first I have Dr. Denise Basso. Dr. Basso is the Executive Vice President and Chief Digital Officer at Ochsner Health. Welcome, Dr. Basso. Next, Henry Hayes. He's the CEO and co-founder of Disrupt Ready. And then Amy Quirk, who's the Senior Vice President and Chief Corporate Development Officer and CEO of Ochsner Ventures. Welcome, welcome. So let me start. You all have remarkable stories about your involvement in the tech sector and innovation. Let me start a little bit to let you introduce yourself and a little bit about that background. Dr. Basso?
Yeah, good morning, everyone. I'm Denise Basso. There we go. That sounds better. So again, Denise Basso. I'm a primary care physician by training, but very early on in my career, I met the founder of a startup company in the clinical decision support space, so in the healthcare IT space, and got very interested in how we could attack the quality of healthcare from a different perspective and try to have a bigger influence. So I've spent the majority of my career in the healthcare IT space, and then transitioned to come to Ochsner just about 3 years ago as the Chief Digital Officer, because I think we just have a tremendous opportunity here to have an impact on the quality of care, on health equity, and on a variety of areas of healthcare using technology.
So I thought I was coming to play golf, just to be fair. I'm not sure what's going on. No, it's good to meet everybody. Guys, I'm from Baton Rouge. Anytime we come to the North Shore, it's like I feel like our bougie first cousins. You know, we're kind of meeting you people. Come back to Baton Rouge, guys. It's great to be here. My name's Henry. I run a company that's a full stack AI dev shop, which basically means we take companies who say, we don't even know what we don't know about AI, all the way to development of typically closed loop or private large language models, such that they use them Monday through Friday. I also teach a class in the Honors College at LSU, where we have the 25 best computer science minds on campus, and we have 5 private sponsors. This semester, those are Amazon, Workday, Our Lady of the Lake, who else? LSU Foundation, and BASF. And those 5 companies will get those private large language models from our students. So we are on the front lines of kind of what's going on the business side of artificial intelligence. 20 years prior to that, I was in healthcare on the biotech and pharma side. So I know where the bodies are buried and where the inefficiencies lie, and so we're taking dead aim at that. But it's great to be here with you guys.
Thanks. Great to be with you. Amy Quirk. I came to healthcare and healthcare technology through economic development, really. My prior role was in economic development, so it's really exciting to be here talking about this topic today, and I just commend everybody for getting together and recognizing the value of drawing the connection between these two important topics. I joined Ochsner about 9 years ago when we were starting up our innovation company called Innovation Ochsner, which was really about building and designing digital health tools using the latest in technology, connected devices, wearables, artificial intelligence, you name it, and then innovations in care delivery to bring that and make healthcare more accessible, better, and keep people healthy at home and not having to go into the office so much. And so I got to spend a long time, about 6 years, working on products and things that we still do today at Ochsner, and we'll talk about some today. But now I work a lot with partnerships and working with innovators all across the world and the country, but a lot here in Louisiana, actually, about how can we work together, recognizing we don't have all the answers, right? None of us do. We have to partner, and to think about what should those partnerships look like, how can we bring those ideas to bear to the benefit of our physicians and care teams, and especially for the patients and the communities we serve. So glad to be here today.
Awesome, awesome. So before we start, I want to give a little bit of a disclaimer. I knew we were going to be talking a lot about tech and a lot about AI. So the questions I used today were actually generated by AI. Both in a nerdy, let me use the technology, but also in an efficient way. So as you go through this, you can judge the computer and not the questions. So Henry, let's start with you. There's been a lot of recent advancements in technology, wearable devices, telemedicine, robotics. What do you believe is going to have the biggest impact on the healthcare industry? And probably more directly, how are those going to improve the care we give patients?
Man, there's so many answers to that. I would say with respect to artificial intelligence and machine learning, I think the way we kind of get folks' heads around it, because guys, this is going really fast. You may have heard this stat. It took Netflix 3.5 years to get to 1 million users on their platform. It took ChatGPT 5 days to get to the same number. And that was 24 months ago this month. So if it launches now, we're talking hours and it spreads the globe, right? And it's speeding up, not slowing down. So if you're not familiar with the technology, we say set that aside in healthcare and say, where is the mundane, the boring, and the tedious in your job Monday through Friday? And we all have it, right? When you can start to pull those things out of someone's full-time employment footprint, and then you ask the question, can AI and ML replace? And we think about 80% of the time the answer is yes. I'll give you an example. The group, my students that are building at LSU for the lake, they're taking every single payer contract the lake has, and guys, you're in healthcare, that's a lot. Even the Blues, just under their umbrella, you're talking about 4 dozen. The machine is learning on every single piece of data within that contract such that the recall is in seconds in terms of what's allowable and the number of days and all those things. If you contrast that where the human would have to look up that information today, you begin to go, wow. There's a saying in our business, never the same again, meaning the metaphor is when we all got this and there's a camera on the back of your phone and the bank said, hey, you could take a picture of the check. And we were kind of like a little nervous, and then you do it and you think, wait, why would I ever go in that drive-through again? That's what we're going to feel in healthcare, but it starts with the boring, the mundane, and the tedious, which that's not the biggest sizzle headline, but that's the way we've kind of gotten around to teach folks how to use and view this.
Dr. Basso, same question. Where do you see healthcare using that technology to bring better care for patients, and where do you see the biggest impact occurring?
Yeah, I'll go off the AI train for 1 second because I think we're going to have a lot of discussion about that. But I'm very excited about the opportunity with wearable devices. And I think that there are kind of 2 threads on that I'm very interested in. So one, the devices are getting better and better for us to be able to measure really important things that happen in our lives at home where we never have to go to the doctor's office anymore. So you can start with very simple things like measuring blood pressure, measuring blood sugar. But I read an article the other day about smart bathrooms that are going to be able to detect whether you have a urinary tract infection or whether you're having other issues, going to the bathroom. So it sounds a little spooky, but I hadn't planned on talking about bathrooms when I came in today, but man, sometimes these things just come out when you're on stage. But it just gives you an example of what's coming for the future. And why is that important? Well, it lets us meet people where they are. So most of the people in this room have a lot of advantages compared to many in our state. And our ability to take care of people in their homes without them needing to get a ride to come to the doctor, without them needing to take time off of work, is really critical. And we have lots of data that suggests that when we can do that, we can actually improve the quality of care. The second thing that's really interesting about this, and here I will delve into AI a little bit, is now we have an incredible treasure trove of data. And when you have all of that data, it allows you to draw a lot of insights and things that we call moving upstream in care, so being a lot more predictive and preventive in care. So we can put together patterns that suggest that somebody might really be in trouble and at risk of having a heart attack, and catch them before that ever happens, and treat them before that ever happens. And this is all possible, and it's it's coming, and so that's why I get very excited about the opportunity from these devices.
Let's pull on that string a little bit with some of the AI advancements that you talked about. You mentioned there's a lot of interest in AI and what it can do, and both. How are you excited about its continued use? But also, how do you address the question of this is going to end up replacing people? This is going to end up being less jobs or less opportunities. But first, maybe talk a little bit about kind of where is that excitement? You mentioned a few programs. What other programs are you excited about with that?
With the monitoring patients, or
with the
just
monitoring
with AI
patients,
in general?
but also with AI in general, I think.
Yeah, so I think work is going to change, but I don't think we're going to be replacing people. I think your mundane, boring, and what?
Tedious.
Tedious, yes, is a really apt description. And taking care of some of those tasks is allowing us to change the work. So just a couple of examples of that. We're able to, one of the mundane tasks that physicians have to do every day is document in the health record. Well, we're now able to use AI programs to listen to a conversation between a physician and a patient, and not transcribe those notes, but actually construct, to extract the important clinical pieces of that conversation and construct a documented note that the physician can then sign. Just saves a lot of, many minutes, hours of time every day for the physician, and frankly, sometimes does a better job of documenting. And then, another example of, patients send a lot of messages to our doctors, and we're able to take a first crack at answering those with AI. And the purpose of that is not to replace the people answering those questions today, which is sometimes the physician, but sometimes the medical assistant or nurse, but just to augment their capabilities. So one of the other things that I get excited about AI is that it helps raise the level of what people can do. It's an incredible, workforce training tool. So we have medical assistants in a number of our offices who often take a look at messages and see which ones they can, are fairly simple, non-clinical things that they can answer. Well, now we give them this AI assistance, and it allows them to answer many more questions, and that means fewer things that our RNs have to answer, and then that means fewer things that our physicians have to answer. So it just raises the entire level and lets our highest credentialed performers do the tasks that they are trained and well suited to do.
I am a user of the ambient listening when I'm in clinic, and can speak from experience that it's actually a pretty remarkable experience. In fact, I read through the notes and go, I did talk about that. And it's pretty remarkable. I actually had a physician who has been struggling with burnout related to the administrative burden that many of our healthcare providers face, who approached me and said, you've added 5 years to my career. I was thinking about retiring, and the ability to have more time with the patient and less time with the computer has allowed me to refocus why I went into medicine in the first place. Henry, that's an example of saving some people in healthcare. What do you say to the people who are worried about this is going to take my job, and how is healthcare going to need to adapt as those technologies come more into play?
It's a great question. I think, honestly, guys, it's more, that's our mindsets as opposed to the technology, meaning I got to be real careful that you're not paying attention to the noise as opposed to the signal. Guys, the genie is out of the bottle. Like, this is happening. So to say, oh, it's going to take jobs, A, it's not correct. B, what is correct is to say, these guys at Ochsner with their venture arm, they, enabled with AI, will take jobs. Not to point to Amy, but like that's going to happen. It's like saying, if half this room, if the whole room is accountants, and this half of the room, I say, guys, give me back the calculators, and you guys keep them. How you guys feeling? Right? I mean, it's an oversimplification, but this is just another tool. Now, the key here is this sucker's a whole lot faster than anything any of us in this room have ever experienced, and it's going to get faster. So at the end of the day, that question is, you can look in the mirror. Like, what is your appetite for change? Can you, with non-emotion and no romance, say, I'm going to figure out how it works. I'm going to figure out who's doing what with it in my business, and then I'm going to get selfish, meaning this is here to serve you, not the other way around. So I think, and look, frankly, guys, as leaders in the community, that's kind of what you owe to your people, right? The shoulder shrug at the crawfish bowl on the weekend going, yeah, I think my kid uses it to cheat at LSU. That's not going to do it. It's not attractive. So, right? I mean, and so one more thing we advocate, it's like 2025, it's time for you to skin your knee, meaning it's time to lean in and it's time to get a skin knee. I want you to make a mistake. Why? Because that's the only way you grow and iterate. I see one of our original clients, Mimi here from the great Money Hill, and several months ago, she saw the light. Now, she's not in healthcare, but we are Monday through Friday, we are immersed already with those folks up in Abita Springs because she saw the light. Now, it came with a couple of skin knees, but that's why they make Band-Aids, and she's living to tell about it. But with those skin knees comes tweaks to your strategy. I bet Amy has a couple of skin knees and stories to tell, but that's how I think about that.
Yeah, and I would just add to the idea that, are we going to lose jobs or not? I think at the end of the day, we talked earlier about the shortages that we're seeing in the number of professionals and the growing needs of the population. These types of tools can help augment the staff that we have. And look, we're all making a lot of investments to grow the amount of clinical professionals we have in the state and in the nation. But, we've got more and more health needs. And as Denise mentioned, we've got a lot more data, valuable data that is going to help us be more proactive, more preventive about healthcare and health, and keep people healthy, working, productive, and in society, and not in hospitals and not in clinics. And so I think a recognition that, one, we don't have enough people to help meet the health needs, and then two, we could be doing so much more with the health data that we have that we really need to to embrace this opportunity that we have to take advantage of these tools so that we can provide the best health for our community.
Let me go flip side of your question. So if you guys have teenagers or young 20s in the room, take jobs. How about add jobs? I can't hire data cleansers and data analytics people fast enough. Meaning clients come to us, hey, we want to do something AI, great. We take a look at their data set. It's dirty, unstructured, and unlabeled. So we can fix it, but it's a heavy lift. So I need young people that know how to data cleanse. That didn't exist when you and I were in college. Now it doesn't. I can't hire them fast enough. So that's the flip side of the coin of, is it going to take jobs? Yes, but it's going to create so many more than it takes.
One of the things that I was thinking about Dr. Cassidy's, Senator Cassidy's story about the advent of Tagamet, and no longer having those problems being treated. We still have more than enough need for gastroenterologists and general surgeons in the world who have been able to continue to expand what they do and grow with those technologies at the same time. Amy, a little bit kind of pulling on what you said a little bit. What are some of the obstacles that healthcare organizations are trying to implement? What are some of the obstacles as they try to implement these technologies that kind of get in the way? And probably more importantly, how do partnerships with tech companies and innovators allow them to have success with that?
Yeah, so in any sort of when we're talking about new technology, and frankly, it's not just technology. The technology enables change in the way we interact with each other, the way we interact with patients. And so a lot of things that large organizations or any sort of organization deals with is a lot on change management, trust. A lot of these technologies, particularly in AI, there's an explainability factor that you can't always tell how did we get from A to B, how is this answer there? And so I think that's one of the challenges that we are all working through, is trying to understand how does this make sense, particularly in a healthcare setting. And so that's why what you're hearing about a lot of the use cases where AI is being used today tend to be in sort of back office or more administrative functions, less so on direct clinical care today, I think because of some of those questions and risks. Obviously, there are just general technology issues around whether it's cyber and privacy and all of those things that are very important in any field when it comes to any amount of data, but certainly when it comes to healthcare data. You've got to take a really hard look at those protections, and that's where partners kind of come in, plus and minus, right? I think one of the things that we know is when we think about the value of working with partners in the tech space is not any one of us has all of the talent, the resources. These are really expensive tools. They require a lot of compute power, a lot of servers, a lot of talent, frankly, that is hard to get, to your point. And so, if we band together and share those resources, right, we're more adept to being able to solve the problem and actually have the impact. The issue then, though, the flip side is when you're sharing information, sharing data, it presents risk around cyber, privacy, those types of things. And so I think we're, as an industry, trying to figure out the right balance of those things, where we're able to share and collaborate and get the benefit of that type of interaction, which we have to do, frankly, because I think one of the threads that's come through in the conversation today is health is about so many things. It's not just about what's in your clinical record. It's about what you bought at the grocery store, what your activity is, how was your sleep, all of the things. And so those are all fragmented data sources. They're all over the place. And frankly, to be able to really impact health, you want to bring those data sources together and then learn from them and then be predictive so that we can actually prevent adverse incidents. And so to do that, we're going to have to share, but we've got to figure out a way to do it in a way that's safe and keeps things private. And those are the challenges we're all working through real time.
Dr. Basso, I think Amy brings up some really important issues around privacy, around cybersecurity. How are healthcare systems attacking and approaching that, knowing that's not their core business?
Yeah, so it's a little bit of the wild, wild west right now, and everybody's kind of doing this on their own, unfortunately, but I think that's about to change. But I want to just underscore the partnership piece, because that both surfaces the opportunity but also amplifies the risk that you just talked about. So when I think about all of the opportunities that we have for AI, for technology in general, to improve patient care, to improve the lives of our workforce, to make this the best place that people want to come and work, it all requires investment to get to those points. And we are a nonprofit health system with 2% margins, operating in a state where we have a lot of sick patients. And so how do we do that? We're not going to, I was talking to a health system in the Northeast a few weeks ago, and they have 50 data scientists. We can't hire 50 data scientists. That's just not going to be who we are. But we can be really good partners to other companies that have data scientists. And so those partnerships become really important, because we've got something they need, which is we know how to implement or to get their technology into patient care, which is not something they can do on their own. So these become really, really great partnerships. But in order to protect our patients, and I take what Senator Cassidy said earlier very seriously, he talked about the responsibility we have. I go to bed every night feeling a tremendous responsibility to keep the data and the privacy of our patients safe and hold that sacred. And so if we're doing these partnerships and getting other people to help us, how do we actually do that? So there's no magic bullet for that now. I think some of it is you have to have a sense of, you have to really understand your partners, and you have to choose them very carefully. You need to put the systems in place so that you can be mindful, so that you are not sending data out, but having people come in. That means doing a lot of the work that you're talking about. We've invested heavily in data and our data and analytics infrastructure over the last year and foresee continuing to do that. We've invested heavily in cybersecurity over the last few years and continue actually to probably double our investment in that over the next 12 months. So it's just really brute force day-to-day understanding where the risks are, and while it's still the wild, wild west, feeling that responsibility and taking that responsibility seriously.
Henry, I'm curious how you approach that same question around privacy, data security, and an important question that a lot of patients have is protection from biases that could present themselves within the AI information.
So to be fair, transparently, I'm the cowboy with the black hat. Like, we're pretty aggressive. So, because look, guys, at the end of the day, ask yourself, did Uber ask the taxi cab's permission? Do they have the medallion on the Honda Civic that's going to pick you up from this place? They didn't. Now, it's different in healthcare, I get it. I think at the end of the day, our theory on healthcare is the patients should and will decide. So if all the things we're bringing to them gets us closer from sick care to healthcare, then the patients will decide, and they'll vote with their feet and their wallets. Now, having said that, there are significant tension points in this industry that, we have a lot of regulation, and so, that's all fair. Our thesis is as many shots on goal as quickly as we can take them to learn, move on, and iterate. That's the key, because the clock is ticking. We've done a lot that I could tell you about, like actual day-to-day insertions into private healthcare clinics, hospitals, you name it. But we take a more aggressive attitude than not.
Amy, I'm going to change gears a little bit here, and we've got a lot of business leaders in the room, a lot of people interested in development and innovation. How does Ochsner Ventures approach looking at a new partner, looking at new opportunities, and what are the key things that are part of that process?
Yeah, I think we've learned over time, right? And what are the key elements of success in a partnership? And I think in this area, you've really got to drill down on the alignment of partners on what the problem is that we're solving. And what is the use case? And what's interesting in healthcare and healthcare technology, there's so much opportunity because there's so many problems to be solved. I mean, there's a lot of things to be done. And so, even with a lot of companies that are in the Louisiana ecosystem that are in healthcare and they're working on healthcare problems, like, we try to track them all, because to the extent that we could work with them or support them, we would love to do that. But what's important at the end of the day for them and for someone like us who might be using them is to make sure, can we be successful together? And there's got to be an understanding are we aligned on the problem to be solved? And everybody's at a different stage in their development. And so I think that's sort of a recognition that, we all, you want to be able to find the path to partner. But at the end of the day, you've got to be crystal clear that we can get it done together and that we want to solve the same things. We've got the same priorities because there are so many problems and so many things to be solved. So we've gotten really crisp around the priorities that we have, the problems that we're trying to solve. Denise mentioned, and you mentioned some of the automation that we're doing to help make the patient interactions work together, for the physicians and patients while they're in a clinic visit, to make that more meaningful and to use technology to allow us to do that. And that was a problem that we heard hearing from our physicians, that burnout was a big issue, that they wanted more human connection when they're with their patients, and that they didn't want to spend so much time doing administrative tasks. And so going to find a partner for that made a lot of sense, right? Because we were going out to find a specific issue. And so I think that ultimately at the end of the day is what's pivotal in any sort of partnership.
That really resonates, because if you're a physician, there's no more greater joy than spending more time with your patient. I mean, I think all physicians will tell you that the time they spend face-to-face with a patient is the most important and most rewarding time that they spend in their career.
And actually, I think so the physicians love it, but the patients love it too. One of the comments that are one of the threads of comments that we've heard in the ambient listening or the technology to help document the patient note, there was a patient that said, "I have my doctor back." Pretty powerful.
So let me give you guys an example of, I'll triple down on what was just said. Okay, prepare for room to gasp. We're cloning doctor voices. Thank you. Everyone gets scared, but let me tell you how we're doing it. The face right here, she does not like that, right? Yeah, stick with me. Okay, what's your name? Tiffany. Okay, Tiffany did not like that. But let me walk you through it, Tiffany. Okay, group of private gastroenterologists in Middle America. Okay, so they're in a competitive situation. We took one of their gastros and took his voice. It took about 30 minutes with our technology. That's why I'm wearing this. Here's what happens now. As you guys probably know, GI's work is day in, day out colonoscopies, and that's what they do. Okay. Pre your colonoscopy, but you're too young for one, but pre-colonoscopy, Dr. Hayes would text Tiffany your phone, okay, because I have permission. "Hey, Tiffany, it's Dr. Hayes. Looks like we'll be seeing you in about 24 hours. 3 quick things. 1, stop eating and drinking. 2, you got to drink the yucky stuff. And 3, have someone drop you off. It'll take about 90 minutes. Thanks." Okay, that's 1. Post-surge. "Hey, Tiffany, it's Dr. Hayes. Look good. Good to see you again. A couple things for me. Stay off your feet for 12 hours. No more driving. And we'll see you in a couple of months. The girls made the appointment. Thanks." Okay, now it's in my voice because I'm her doctor. 2 things have happened. We've run this now for 3 weeks. 77% drop in phone calls to the front desk. Why? Because those things that he was telling her are the thing. What time do I need to be there? When do I stop eating and drinking? And number 2, here's what's happening. Most of the messages are going to men. Guys, they're copying the message and sending it to their buddies and going, "Look what my doctor sent me." Because they want more connectivity with their physician, not 9 minutes. So when you begin to think about the things that we can do in the right way, because in the wrong way, that is a bad that's a bad technique. But in the right way, so we just started that, but it's been a really, really great thing for the doctors because the patients feel more. It's a one-to-one relationship.
So kind of taking that a little step further, at the end of the day, Louisiana is still 50th in health outcomes across the country. And as we bring these technologies to bear, how do these technologies help our most underserved communities? What are some ways that they can improve health inequities that exist and bring better care to all parts of Louisiana? I think, interestingly, right here on the North Shore, we have one of the healthiest parishes that we're sitting in right now, and just to our north, one of the unhealthiest parishes. And so how does this technology allow us to bridge those gaps? Dr. Basso?
So I'll talk about 2 things. One I'm sure about and one I'm hypothesizing about. So what I'm sure about is what we've already done from a remote patient management perspective, so doing some of that at-home monitoring for chronic diseases. And we did this, initially we were going to do a Medicaid pilot of about 1,000 patients. We're now over 7,000 patients because of the success of the program. And what we found was that when we allow patients to monitor themselves at home and we get that data and we can communicate with them by phone, by text, again, they don't have to come into the office, we not only improve outcomes for everyone, but we also reduce health disparities. So in most places around the state, outcomes for treatment of these chronic cardiovascular diseases are about, white patients do about 10% better than black patients in virtually everything that we measure. In this Medicaid pilot that we did, we completely wiped out that disparity. Black and white patients had nearly identical outcomes. And so sometimes we talk about patients being non-compliant, and I actually hate that term. I view it as a failure of the medical system to meet patients where they are and to allow them to participate in the health system. So I think, so we know that we can do these things. I think the one that I'm super interested in, but we haven't fully tested yet, and it's not quite cloning voices, but in a similar vein, using AI agents to deliver health coaching or to help with some things around social determinants of health. And what we know, so first of all, these agents have become quite remarkable. I was talking to one, literally talking to one a few weeks ago, trying to trick it, and I could not trick it with what I thought was fairly complex medical terminology and medication use. So the technology is there. It's pretty amazing. But what I'm also compelled by are the data that show that people are often much more willing to open up to a chatbot than they are to a human, because they're not embarrassed to say, I actually like to eat sugary cereal every morning. And the chatbot will have that conversation with you, but you don't want to tell your doctor you're eating a sugary cereal every morning. So I think it just has, I think the technology is really close, if not there, and it just has an opportunity to reach people in ways that we can't do it now.
I can also speak from experience knowing that patients really struggle to tell their doctor sometime the things that they maybe aren't doing. They almost feel like it's a contest with their doctor, right, to win that game. Amy, you had a...
Yeah, I was just going to give another example of, I think, how these technologies can really powerfully help impact everybody in our state. And one is around maternal health and having a baby, and which really should be a joyous time, but our state ranks really low in maternal health outcomes. And so we developed a program called Connected Mom, which uses connected technologies, or blood pressure cuff, and a scale to help mom from home or work or wherever she is be able to send in regular readings to her care team to just monitor her week to week. Rather than going to the doctor just 14 times during her visit, she could stay in touch weekly. And what that allows is benefits. One, mom doesn't necessarily have to take off work all the time to know that she's doing okay at this really important time. She can be at work or living her life. She doesn't need to arrange for transportation if transportation's an issue. Two, she may not need to go into the office as much. And what we found is if everything's going okay, there are a couple of visits, maybe 4 or so visits that she doesn't need to go to, which is great for her life, for her productivity. And she can stay keeping it in her life. But if there is an issue, and this is what's important and really exciting about the predictive power of these tools, she can come in sooner, and we can know that there's something that she needs urgent attention on. And so these are important use cases that impact so many of our families, and really that allow us to bring the right intervention to people wherever they are, in rural areas or in the cities, and allow them to integrate being as healthy and as proactive about their care as possible in a way that I think helps make the state stronger and healthier.
That's fantastic. I wish Senator Cassidy was still here, because I think he was part of that conversation.
Well, I meant to mention that. He was a great champion when he heard about what we had done with Connected Mom. He actually authored a bill and became an act, Connected Mom Act, to encourage that type of proactive care. And so he's been, very supportive of those types of things and really understands the value of it for the nation.
And real quick, to piggyback what she just said, for those of you still kind of struggling with what is AI, so what Amy just said, imagine an AI agent watching that data and that particular mother with 20 million lines of code per another pregnant woman. You see, so that's the power of the technology, meaning what it's trying to do is be predictive. And when you give it that amount of data, it's so powerful. So that's a great example.
So I think after talking about a great program like that, and like I said, these issues are paramount in the state that we live in. I wanted to take a chance to give you all an opportunity, if you all have any questions for the panel, or anything that you wanted to ask the group that we have here about the onset of technology and what you see coming to the healthcare world. Any questions?
When that patient gets the call with the AI-generated voice, does he or she think it's actually a doctor having reported that himself for that individual?
It's the doctor's voice.
Do you think that it's the doctor himself or herself that actually recorded that? It's left up in the air.
Yeah, I don't know, because you can't tell the difference.
Yeah, I think that's a great question. Even with these AI agents, our default now is to be very transparent about when something is AI generated versus not, because again, it's a bit of the wild west. There aren't any rules or regulations about that, but that's been our default.
But we lean into it. So one of our docs up there, he kind of makes fun of it, like, hey, you're getting I forget what he called himself, but so that's a marketing choice.
Any other questions?
I think the icebergs are pretty good while we're waiting for another question, in terms of it's not all sunshine. So if you guys want to know like what's directly in front, and it's not so much healthcare. Have you guys talked about the need for energy going forward this morning? Have we talked about that? Guys, so are you aware that if you do a Google search on your phone right now, pick your search, and if you do a Chat GPT search, same thing, the GPT search is 10x the energy consumption. 10x, not twice. So we're in an environment where every American that has a GPT account today uses it 7% Monday through Friday. So that's low. So as that rises, we're not going to need double and triple our energy size, guys. We're going to need 20 and 30x more energy, which is 2 weeks ago, you may have seen Amazon bought 3 Mile Island. You remember that? The nuclear spot up in northern New York? They bought it. So these things are, that's an iceberg dead ahead.
Well, Dr. Basso, why don't you wrap us up with just, maybe what's one thing, we talk a lot about 5-year strategies and 10-year strategies, but this is really a 6-month, 1 year kind of conversation. What is that one thing on the horizon that you're most excited about to leave everybody with today as we wrap it up?
I think we've talked about a lot of the things that I see coming that I'm excited about. I spend, I'd say, 80% of my days thinking about how to make work easier, and for our clinical teams, given the workforce shortages, and how to improve access for patients. So we haven't talked a lot about access for patients yet, which is a big problem throughout the entire country. But I think there are a lot of opportunities, and we're working on many of them, to try to use these technologies to make sure that we get patients to the optimal care spot given the issue they're having, given their where they live, any social determinants they might have about transportation, and all of these factors that become really important in how patients access care. And so we're partnering with another company to really work on these issues, and because I think if we can optimize the mode of care, whether that's virtual, in person, wherever it is, I think if we can get to that level of optimization, then we can solve a lot of the access problems. And if we can solve those access problems, then that is a gigantic a win for our patients.
So, wrap it up. I think we're at time, so we'll wrap it up. I really appreciate all of you on the panel, Amy, Henry, Dr. Basso. Thank you all so much. Round of applause for them. Excited to bring Chris Massengill. Chris, coming to stage to introduce our next speaker. Or is Ashley coming up?
All right, ladies and gentlemen.
Okay.
If I can get everybody's attention again, please continue to transition. If you want to get a snack, another cup of coffee, I saw some energy bars that they had just placed out. We have refilled the PJ's coffee. Thank you to Ballard Brands for providing that today. I'm going to go ahead and get us started on this next discussion, and we are super excited about this. If I can get everybody to kind of readjust here. I mean, really, Ronnie, right? This is exciting, though. This is great. See, this is what happens when you invite Henry Hayes to anything. He gets everybody talking about innovation and all these AI pieces. And by the way, you know, if anybody is in the data center business, Sterling Properties, which Chris Abity, we've got a place for a data center at Gulf South Commerce Park. So just put that in your hat. Okay, ladies and gentlemen, please let me get your attention. I have the real special and distinguished honor today to introduce our keynote, Pete November, CEO of Ochsner Health. I'll tell you, from the moment that this idea came up and we approached Dr. Rydell, thank you for helping to make that connection with Pete. And we were at Southeastern with Dr. Wainwright and made an introduction. We pulled aside. I said, Pete, here's an idea that I got. Actually, Marty Meyer planted that seed for us to do an event around healthcare and health innovation and its connection to economic development. And when we had that opportunity, I said, Pete, here's what we're thinking. It may sound crazy. I know I'm hitting you by surprise. And he goes, why haven't you already asked? I'm in. Let's do this. And it gave me an opportunity to start learning about Pete November in a more deeper way. Not that he's just the CEO of an incredible healthcare institution, one of the largest in the state, 38,000 employees, 4,700 physicians, the recognition of the economic impact that Ochsner makes. But it gave me an opportunity to understand a little bit about his passion for economic development, his passion for increasing access to health care, him being a champion for innovation in the multiple roles that he's had at Ochsner. But the one thing that really struck me in the conversations I've had with Mr. November is that his true commitment to his community and the recognition that when you have greater business investment, when you have increased job creation, when you're growing your economy, it has a direct tie and link to the prosperity of the health and the healthcare ecosystem that we're providing in this state. And it's one that it struck me as like, wow, here is a major CEO that is so approachable, can have a conversation with you, can engage an economic development practitioner and say, hey, how can we work together, which has really been the theme today. Collaborations, alignment, innovation, partnerships, and that's one of the things that I have really taken away from my engagement with Mr. November. Now, you all know him as the CEO of Ochsner Health, but just providing a few other notes of takeaway for his background. Aside from being a CPA and a lawyer and many other accolades, the roles that he's played at Ochsner has been very impressive. Been with Ochsner now for almost 14 years, has called Louisiana home for he and his wife of 29 years and 2 adult children. And the fact that he's now become recognized for a CEO who drives innovation, who drives quality care, and who is engaged in the community, not like many corporate CEOs. He's an unbelievable corporate citizen. His track record of being involved in the community is a testament to his continued commitment for raising Louisiana in the rankings. And I am proud to partner with this event with Mr. November and his team. Pete, you have an incredible team on the North Shore, and thank you for picking such incredible leaders. Ladies and gentlemen, I'd like to introduce to the stage now for our keynote address, CEO of Ochsner Health, Mr. Pete November.
Good morning. How's everybody doing? Good. It is a huge honor to be here. I'm with you this morning, and I'm looking forward to my conversation with Joan and Sandy. Before I begin, I do have one piece of business I need to take care of. I'm Dr. Wainwright. Both your students are hired. We look forward to working with both of you. I'll pull this up so we can have a conversation, but when Governor Landry was running for governor, the first time I met with him, he came to me and he said, Pete, he goes, how do you fix healthcare? And I said, you create jobs. And he said, no, really, Pete, how do you fix healthcare? And I said, you create jobs. And the truth is, what I probably should have said, if you want to fix healthcare, you need to be St. Tammany. Because if every parish in the state of Louisiana was St. Tammany, we'd have a lot more healthy people. Have a much better economy, and healthcare would be better. And so I hope all of you in this room are super proud of what you have done as leaders of St. Tammany Parish, because you really are the example of what every parish in the state should look like. So let's give all of you a round of applause. So at Ochsner, when we have events, we normally have a patient story, and we didn't have a patient story this time, because it's not a typical Ochsner event. But when I walked in this morning, one of our employees actually told me a story, and as I'm apt to do, to go off script, I thought it would be a good way to start with a patient story. So I'm gonna ask Tiffany Ducote to come up and tell you all the story that she told me this morning, because We're going to talk about a lot of things, economic development related and about Ochsner and about St. Tammany. But it's important we always remember what we do is we take care of people. And that is what we do every day and what we're so proud to do. And I think this is a great example of why we all are here today.
Thank you very much. I did not expect to be speaking today.
She'll never talk to me again.
No, and you don't, when he asked me to share, you don't tell your CEO no. You don't do that. But in 19, I took my boys on a cruise. And at the time, they were 11 and 4. Now, my youngest is 4, and he has Down syndrome. Up to that point, he'd been pretty healthy. He'd been great up until this point. He had an ear infection, which turned into pneumonia on the cruise. Now, if anybody's been sick on a cruise, I hope you have not. It's not the best place to get health care. I was very afraid, very afraid. I contacted my leader at the time, explained the situation. They couldn't even get an IV on him in the cruise. The closest dock was Roatan, and the administrative folks on the boat told me that we had to get off. He was too much of a liability. His oxygen saturations were in the 80s, and no IV. He looked great. So I got my baby, got into an EMS, or I don't even know what it was at the time. They brought me to a hospital in Honduras, and before we got on that ambulance, I had contacted my leader, and he immediately got the regional referral center involved. And I had conversations with Dr. Quo. I'm not sure if you guys know who he is. And the system chair for pediatrics, Dr. Linares, and they told me they were going to do their best to get us out. So I white-knuckled for 18 hours in the hospital with my son, language barrier. They administered meds to him that were no longer FDA approved in the States. I was terrified. That's probably the most afraid I've ever been in my life for my children. To describe the relief I had when 2 Ochsner flight teams walked into this hospital in Honduras is, I can't put it into words. I cried hysterically. I held it together until that moment. And they got us out, and we landed, and we went straight to Ochsner Hospital for Children, where they gave him everything. I just was able to just breathe in that moment. And the physician at the time told me that he was on high flow O2, that if he had to go up 1 more liter, he was going to have to be intubated. That's how close we were to a very critical situation. And knowing in Roatan they did not have the equipment to intubate him. So literally, I'm not sure many people can say that your employer has saved your children's life, but I can. And for that, I'm truly grateful. We still have care there, and we've been at St. Tammany for hospitalizations. We never have to leave the region for any of our specialty care. But I am grateful to Ochsner, and I will always be employed with Ochsner for saving our life.
Thank you.
Thank you.
Good job. All right, so there's not much else I'm going to say that really matters after that. So just, I want to begin just a little bit about Ochsner, and I promise we won't make this a commercial. Proud that, today we have about 40,000 team members across the region. We take care of about 1.5 million patients per year in 23. That number will be larger this year. One of the things when we talk about economic development, we have people from 65 countries who come to see us for care. So those are people from all over the world who come into our region, and that certainly helps with economic development. 46 hospitals, and then, really proud for 13 years in a row that we've had the #1 children's hospital for 4 years in a row. And so, this is just an example of some of the things about Ochsner and the great physicians, the great nurses, the great caregivers we have, and the great things that our people do every day. And you've gotten to see a lot of our great leaders this morning, and I say as long as I just don't get in their way and screw it up, we're going to be great because of all the great people we have. When I took this role, one of the things that was really important to me is for people to really understand who we are. Because I think if you read the newspapers, you can say, well, Ochsner's this really big organization, and they're about trying to do acquisitions and take control. And it's funny, the first time I got interviewed by the media, when I took this role, their only questions were, what are you buying next? What are you buying next? What are you buying next? And I had to stop them and said, we actually take care of people. We don't just buy stuff. But I do think that part of, the growth that we have, which was important and has led to a lot of the innovation that we talked about, sometimes I think people externally and maybe even internally didn't really know who we are. And so I do want to make sure when you walk out of here, you know who we are, not just what you read about in the newspaper. So, we talk a lot about our purpose, and our purpose is to take care of patients. It's to take care of people. That's why her story is so important, because that is literally what we do every day and what we're blessed to do. Our purpose is to take care of each other. 40,000 of us, and our job is to not only work with one another to take care of people, but to take care of each other in good times and bad. And I don't want people coming to work in our organization feeling like it's a job. I want them to know that they're coming to a place that treats them like family, and we support them both inside of work every day and outside. And then also, it is our purpose to take care of our communities. As we got big, we don't just get big to be big. We got big because we have a responsibility to take care of the communities we're in. And that doesn't just mean taking care of people. It means education. It means economic development. It means taking care of crime. It's all of those things, because you don't get big just to be big. You get big to do something right. And part of that for us is taking care of our communities. The other thing that I thought was important for you all to just understand, how do we expect our leaders to lead? How do we work with each other? And then this is also how I expect, candidly, our people to work with all of you in the community. We don't have all the right answers at Ochsner. We got a lot of great people, but we're learning every day, and we only get better by working with all of you and learning from all of you. So, if you look at this, it's about staying focused on our purpose, listening and seeking input. That's why days like today are so important, because we can seek input from a lot of different people from a lot of different industries and organizations. Trusting one another, and it's not only important we trust each other in the organization, it's important that all of you trust us as your community partner. Celebrating differences. Showing appreciation. One of the things I do when I have our executive team meetings is we start every meeting by going around the table and talking about I ask everybody to say something that they appreciate that somebody in the organization did, or somebody at that table. And you'd be amazed what that does when people are able to show appreciation. And as you can imagine, in a healthcare organization, there's a lot of things that happen every day that people are appreciative of. Quality and excellence, respecting each other, collaborating with one another, and that's when we talk about partnerships. Respect and collaboration and trust are incredibly important, and then being honest and ethical and transparent. So that's what we expect, how we expect our leaders to lead, that's how we expect our employees to act, and that's how we expect to work with all of you in the communities. And so I thought that was important, because again, you can read about us in the newspaper or on the internet or whatever, but that doesn't really tell us who we are. Slides show you who we are as people and as an organization. This is the map. We did grow significantly, and so we are now all throughout Louisiana. We are in Mississippi on the southern Gulf Coast, and up in sort of northeast Louisiana, we in Alabama today, and we have a couple of clinics in the panhandle of Florida, and a few clinics up in North Carolina as well. I do get asked what are the next thing that we're buying, and I don't know. The answer is I actually don't know, because that's not where I'm spending my time every day. Conversations, but Dr. Basso said it best. She gets up every day focused on how she can help make the lives better for the people who take care of her patients, and that's what I think my job is to get up every day and do what I can to help the people that take care of our patients have the resources and the environment that they need to be great at that. And so that's where I focus my energy. Sometimes that does mean I talk to people in other markets about should we do something. But if we're going to do it, it's because they have the same culture and the same focus on patients and community and the people they work with that we do. And if we can find that, then we'll do it. But we're not just going to do it because of an economic reason or just grow for growth's sake. This is the map of Greater New Orleans. Today, in that area right there, we take care of, just in our clinics, 500,000 people. It shows up in our hospital. Those are just the people that are in our clinics. And, you know, in this region, it's about 200,000 people that we take care of. And we take that as a great responsibility to provide them great care. I get asked a lot. I didn't really know I would get asked this question so often when I took over as CEO a couple years ago. They're like, well, what do you want to be? What does Ochsner want to be? And, you know, when I think about that, if you look at health systems around the country, some of them would just want to be the biggest, and that's their focus. And that's not really what I think our focus should be. What I think our focus should be is we want to be the best. We were founded by 5 physicians about 83 years ago, and those 5 physicians founded the organization because they wanted to be thought of as the Mayo Clinic and the Cleveland Clinic. And that's who we want to be thought of. And I don't think that's unreasonable or something that we can't achieve. I know we can achieve that. And that is our focus. So, you know, certainly you have to be big enough, and we've created a lot of scale, and it doesn't mean we won't continue to grow. But I think our emphasis on how do we build programs and how do we take care of people in a way that we could be thought of as the Cleveland Clinic or Mayo Clinic around the country. And in a lot of ways, when you travel around the country and you talk about the Gulf South, we get talked about in that clinic group with Cleveland and Mayo and Geisinger and Henry Ford and others. But we have to earn that every day and by building great programs. And that's who we want to be. You know, to do that, you know, part of what you've seen us do is the MD Anderson relationship, which has been talked about some this morning. We're certainly proud to be in that relationship with our partners at St. Tammany. You know, that was just a situation where the best cancer provider in the country and probably in the world is MD Anderson. And, you know, we were building great cancer programs at Ochsner, but it turns out every year there's about 30,000 people in the state of Louisiana who are diagnosed with cancer. And a lot of them were having to leave the state to go get care, and we're going to MD Anderson. And so they said, look, if you guys are building great cancer programs, that may not happen someday, and people may not come here. And we said, look, we want to cure cancer faster. So the best way to do that is to partner with the best cancer provider, I think, in the world, and that was MD Anderson. That partnership has turned out to be far greater and better than we would have ever expected. And it's not a marketing partnership. Our physicians led this. They went over. Our clinical protocols are the same protocols that they have at MD Anderson. There's common credentialing from a physician perspective between the two organizations. We have access to all the clinical trials. You know, there are people friends of people in this room who have received care at our organization for cancer who have received cancer care at our place, and in the same day are getting a telemedicine visit with a doctor at MD Anderson. We've seen a huge increase in people staying at home in Louisiana and people staying at home in St. Tammany to get cancer care, and that's a good thing. And I think for us it was also a great relationship because it allowed us to be humble. We had been on the other side of doing a lot of partnerships, and this is one where we were on the other side of it, and I think we learned a lot from that, which is a good thing. And the one great thing I've learned about MD Anderson is they are a very humble organization, and when they talk about our relationship, they've learned a lot from us, which surprises me every time we talk about that. And so I think for a lot of reasons, this has been a great relationship, and I do think it will go a long way towards helping both hopefully cure cancer someday and certainly let people get better care in our state. The Neurosciences Institute that we are building, I think many of you know that neurological disease has become more and more prevalent, but also what the good news is with research, the treatments that are available today are more and more prevalent. And so this region had a need for greater neurosciences care, and so this facility will be a beacon to bring people into our region to receive that care, and we'll have research and capabilities going on there that don't exist anywhere other than there between Houston and Atlanta, and so very excited about that. Our children's hospital, I always begin by saying we have a children's hospital. Despite what you read in The Advocate sometimes, we have a children's hospital, and we have had one for a long time. We provided pediatric care for a very long time. The hospital beds today are in our West Tower on Jefferson Highway, and we provide great care there. It's been ranked as the #1 children's hospital 4 years in a row. We have 3 programs in the top 50. And so we are building this new facility right there on our campus on Jefferson Highway, which is just going to be new space for what is already our existing hospital. Very excited about this project, and it also will create economic development in addition to giving greater access to children for care. And Matthew talked earlier about the Xavier partnership. Today we do, we have great relationships to LSU and Tulane in terms of clinical rotations there. Residents and their students come through many of our facilities. We've got a strong relationship with them up in North Louisiana as well. We've had this relationship with the University of Queensland where we graduate about 100 students, medical students per year. They do 2 years of their classroom work in Australia and then 2 years of their clinical rotations with us. This partnership will help solve the problem, the shortage of physicians, and certainly the shortage of diverse physicians in the country. And as many of you may or may not know, more students come out of Xavier and go to med school than any HBCU in the country, and more students come out of Xavier and go to medical school than most larger institutions in the country. In fact, somebody told me that more kids come out of Xavier every year and go to med school than out of the University of Michigan. So that just gives you an example of why this is so important. We also, as Amy alluded to, we take seriously our obligation in terms of economic development. And so we are always looking to invest in organizations and startup companies in the healthcare space that can not only help advance healthcare, but help advance economic development in our region. From a community health perspective, today we take care of more Medicaid patients than any organization in the state of Louisiana. Back to sort of our commitment to the community, we've been building community health clinics around the state. If you look at the 15,000 patients get taken care of in those clinics, and one of the best pieces of data, just through the patients cared for there, we've decreased ED visits and hospital admissions by about 18% among that population. So we do take that very seriously. We'll continue to grow community health clinics and fulfill our obligation to take care of people in the communities, regardless of their socioeconomic status. And then, you can see this. This community is amazing with our partners. A lot of great things have been able to happen. We've certainly done a lot of great work in the education space and look to continue growing those partnerships in the education space. And there are other educational things we've done around the state, like our John Ochsner Discovery School, both in New Orleans and the Discovery School in Baton Rouge. And we are open to doing similar things like that up here on the North Shore. Again, we take our responsibility around education seriously. I think it's important that we educate the next generation of leaders, and we take that as something that we're excited about and part of our purpose. This just shows the breadth of our community commitment. And then one of the things, and we'll talk about this when Joan and Sandy come up, is people ask all the time, explain this partnership that you have with St. Tammany or Slidell. And people have lots of different conversations about what it really means. What it does not mean is that Ochsner came and partnered with St. Tammany or Slidell with an intent to control them or take over them or to take away the community assets. In fact, it was completely the opposite. The idea was you had great community hospital organizations, and so how can we work together to expand care and have more people stay at home? How can we allow the innovation that Dr. Basso talked about to be shared with our partners? How do we grow jobs? And then, healthcare, as we've talked about this morning, is a large business that creates a lot of jobs, but it requires scale. And it is better for all of us to work together to create that scale than all of us to work individually. And so that is what it's about. And we have proven that. I mean, you can look at the stats. This is Slidell, and I'll show similar stats for St. Tammany, for our relationship with St. Tammany. increased providers, increased jobs, increased clinic visits, increased surgeries across the board. So more people being employed and more people being taken care of. Oops, I was doing so great too. All right, I'm going to try to get that picture. I know. Go one. Somebody click that slide one more forward for me. Go back. Go back. One slide. There. There we go. So the Slide One Memorial Tower expansion, and Sandy, I know you'll talk about that, but that just recently opened back in the fall. And I think you will say that that was possible because of the partnership that we had and the growth and the patients that we're taking care of. And I know you're really proud of that, and we're really proud to see you do that. And from a Slidell perspective, one thing that I will say is, people don't know this. So Sandy is actually the CEO both of Slidell Memorial, but also the Ochsner Hospital as well. So when people say, well, was this about taking control or the community asset not being there, it couldn't be anything further from the truth because she's now the CEO of our hospital in the Slidell market and both hospitals and doing a really great job. And so I think that's just important for people to understand. And then same thing on St. Tammany, increased providers, employees, clinic visits, surgeries, infusions. Talked earlier about the new ASC. There's been a lot, I know the hospital has expanded as well during that same time, and that's been a great relationship that has just allowed more people to get great care close to home. And so just really proud of the partnerships that we have, and I think there's been a lot of success. And so with that, I'm now going to invite Joan and Sandy to come up and share a little bit with us.
Y'all look good down there.
They do look good. They do look good. All right. First question, and Joan, we'll go with you first. So we've had these partnerships on both sides of the parish for quite a while. From your perspective in the West, how's it benefited patients and the community?
Oh gosh, Pete, when I think back on St. Tammany Health System, we are, as you heard Ann say earlier, celebrating 70 years this year. So I am inviting everyone in the room on December the 1st from 5 to 8 p.m. to St. Tammany Health System, our flagship hospital, to celebrate that wonderful milestone. But when I think about truly the partnership, St. Tammany Health System, and Pete, you touched on this, was really created by community leaders, much like the group that's in the room today. And that is important to us to really fulfill our mission in taking care of our patients and their families. And when you think about what our mission statement even is, it begins with, we are the heartbeat of our community, and we live that and breathe that every single day. In terms of the partnership, which we are now 10 years into the partnership, we made a very solid commitment that the goal of the partnership was really to provide the ability to continue to serve our community and to not, to Pete's point, take over one another. We maintain our own governance. We are very relevant in the community individually and collectively. And together we have been able to grow volume and support the community in ways that we hadn't before. So when I say that, I would tell you that just last year alone, we served through our primary care clinics collectively about 150,000 patients. We also saw in our all across our health system about 480,000 visits annually in the outpatient arena. But when you think about our growing community, and think back on the slide we saw earlier, over the next 10 years, we're going to grow another 16%. That's significant. But together, we're able to think thoughtfully around what are those services and programs that we need to continue to meet the needs of the community. And then I'm staring straight at our upcoming vice chair of our Board of Commissioners, and I would be remiss if I didn't say that one of the things the board has been very focused on for the time that I've served with St. Tammany Health System is making sure that we are leading with responsible growth. But at the same time, we really keep our patients at the center of everything that we do so that we can maintain those high quality care outcomes that our community so deserves.
Same question.
Same question.
Thank you, Joan. Teamwork. Really great to be here. A lot of great work going on in Slidell, and thanks to the Slidell team that's with us today. And I see one of our Board of Commissioners is here with us as well. You know, the premise of our partnership with Ochsner Health is very similar to what Joan just said. You know, keeping care local, you know, keeping our community hospital. You know, we're still a community hospital, still governed by the state of Louisiana. We are a governmental entity, and it's a beautiful relationship to be able to bring all of the great things that you heard on this stage today. Dr. Basal talked about all the technology and innovation and all the great things that our partner is able to bring to the table for us in our local community. So we're still the local hospital. We have 2 hospitals in Slidell. Really excited. They're about 1.6 miles apart. A lot of great work happening, and so grateful for the partnership. And we definitely are. People ask me every day, similar to what you said, Pete, are we better together? And the answer is absolutely yes. We're growing. Our numbers in primary care and specialty clinics have almost doubled since the beginning of our partnership. This year alone, we're up 20% in all of our inpatient volumes. We're offering care. What this means to our patients in our community is we're offering care that we never had an opportunity to increase in access to care. The recruitment that our partners help us recruit physicians. We're up, you know, continuously adding jobs, not only in the hospital itself, but our physician clinics and across our entire Slidell footprint. So really excited where we are and where we're headed.
Yeah, one thing that occurs to me, just listening to you all talk and look at these stats, we also can't forget we had a worldwide pandemic that nobody expected in the middle of all this, and probably the worst economic crisis in healthcare that has existed in maybe ever through all this. And so to go through all that and still do this is pretty remarkable.
Well, and I would say, Pete, adding to that, you know, as part of when the pandemic hit, you know, having the structure of Ochsner Health System in order to help us lead through that awful time we all went through was incredible. So I would just, that is another thing that I think people don't see. As part of our partnership, we were on daily calls with the system, Ochsner Health System, as well as the state of Louisiana, and we were getting the help that we needed through our partnership.
Pete, I would be remiss if I didn't also bring up the broader partnerships when we're talking about partnerships in the pandemic. And that comes back to what we talked about a little bit earlier with respect to Dr. Carlson, Dr. Wainwright, and the work that they did through Southeastern and North Shore Technical Community College to partner with us through North Shore Healthscape. Thank you, Chris and Ashley, for creating that for us to really make sure that our needs were being met. They accelerated curriculums. They really identified through conversations with us what were our hot spots and how can they help. We are so blessed to have this community collaboration. And quite honestly, I was telling somebody this earlier this morning, you know, to me, the beauty of bringing people together like this in a room is what you take away from it. Because there have been so many different sidebar conversations of things that we can take from today and build upon to enhance and benefit our community. But I did want to talk to Dr. Carlson after this because I did notice on the outmigration of medical curriculum or medical folks who are training here in the North Shore area that 2% are going to Minnesota. Don't you have a Wisconsin background? We need to go together and do some recruitment.
I have to say, I asked the exact same question. I looked at Gwen and said, Minnesota? How did that happen? All right. I also do want to echo just the importance of the educational partnerships. Dr. Wainwright and I were talking about this earlier. That has been, you don't want to go through a pandemic, but one of the things I think we did learn going through that in the workforce crisis is the importance of the relationship between, industry and academic institutions. And if we work together, we can solve big problems. And I think those relationships have gone a long way towards helping solve the workforce crisis. And you've been a great example for if we work together, what we can accomplish. So I do want to say thank you. All right. We're probably not going to get to all the questions because they're going to yank us for time. But we're talking about healthcare and our partnerships. What lessons have we all learned from our partnerships that can be applied more broadly to just the overall collaboration that we're trying to create here in order to help both St. Tammany but the entire state of Louisiana?
So many in this room have heard me use the term co-opetition. And Pete, as I was listening to you ask that question, that's exactly what came to my mind. And I stole it from our friends in Wisconsin. Because to me, the beauty of where we are right now, when you think about healthcare as a sector in the state of Louisiana, we actually employ 16.8% of the population in the entire state. That's a lot. We are the leader in that industry. And I think it's important that we use our weight together to make sure that we are doing everything that we can to continue to grow our great state in a meaningful way. Yes, St. Tammany Parish ranks #1 in terms of health outcomes, but as a state, we're still at 50th. We have a lot of human outmigration occurring right now. So while we have a lot of challenges that we're facing, look across this delegation. We've got the right people here today that if you walk up and say to this table over here, hey, this is what I'm dealing with today, do you know anybody that can help me? And they're going to organize a team from this community to come together and make that happen. And then the last thing I'll just echo is the comment that Dr. Wainwright shared with us early this morning with regard to what's going on in terms of planning for additional education and expanding the workforce. We would benefit tremendously by the creation, thank you Frank Jabia, of a vision to have a magnet education system in Lacombe so that we can all benefit across the entire, not only St. Tammany Parish, but Washington Parish, across the entire North Shore region, keeping our youth here locally, educating and training them through the work of the health systems that are in our area to keep care here in our community and keep the workforce here in the community and to continue to grow it. So what I would say is I think there's tremendous benefit by a large community like ours that cares so much about the community and wants to make it better and brighter for everyone.
Anything else?
No, that was, okay. Wow. No, great work. I do think collaboration, as Joan said, and you heard it all throughout today, that is something that I think the healthcare community here does a really good job. I think COVID brought us together, and we've not separated since. And everyone from, Mr. Jabia at the school system to Mr. Carlson at North Shore Technical College, thank you for all of your hard work and support. As I look across the room, Mr. Wainwright at Southeastern University, all of the great partnerships that we have to help move not just our partnership with Ochsner Health, but with our greater community. So I think all of that it continues to make us better. We all reach out, even our partnerships. As I look across, Lakeview Regional Medical Center is on many a task force with us through our North Shore Healthscape project, and we're all connected through Chris and Ashley Llewellyn. Thank you for all your hard work and bringing us together and making us better, because we do need help and we don't have all the answers all the time, and we do reach out. And there's not a better partner we can reach out to anyone in this room and get the help that we need to support our local community hospitals. So thank you.
All right, so before they give us the hook, I want to let each of you talk about one really important thing for both of you. So, Joan, you opened your academic center and the family medicine program. That got mentioned a little bit earlier, but you want to talk about that?
You know, the pipeline is so important. And talking about coming out of the pandemic, we were really struggling at St. Tammany Health System, not unlike any other hospital or health system across the area. But what was so important was those conversations we were having with our partners. So we did work together with North Shore Community College as well as Southeastern to really, under one roof, right on Highway 21, create the St. Tammany Academic Center. And as you heard earlier, we are busting at the seams in a very positive way. We started 1 year ago with 80 students, and now we are looking at 160 students. So it's doubled already, and we still have capacity, right, Dr. Wainwright? We have capacity to continue to grow. We just have to make sure we have transportation to support that. But the value of that is that not only can someone who wants to go into the nursing field come in and get their associate's degree with the technical college, they can stay under that one roof and pursue a baccalaureate degree should they choose to do that. They don't have to leave the organization, and they do all of their curriculum for hands-on at St. Tammany Health System. But it also gave us the opportunity to look across at other job classifications that we have, and how do we upskill our existing workforce in that location through the resources that they offer. So it's been a huge asset to us. And then Pete, you know, with regard to graduate medical education, Dr. Pat Torkson is here with us today. He's our Chief Medical Officer. He truly had a vision for standing up a graduate medical education program. And through the partnership with Ochsner, they are the sponsoring institution. We stood that up on July the 1st of this year. We started with 6 residents in family medicine. That will expand to 8 this coming July in 2025, and we will end with probably a cohort of about 24 rotating every 3 years. So we're very excited to have that in our new North Covington location that St. Tammany Health System built to house that group. But what it does is to create that pipeline of primary care right here in our community. Because what is the statistic of those who train in our state, who want to stay in our state? It's too low, but it's about 60%. So I think that's important. You know, how do we keep folks trained here to stay here? So we're very excited for both of those things.
Great. All right, your tower.
Yeah, so in Slidell, if you don't know, we opened up a 61,000 square foot building. It is a new patient care tower and surgical services. First floor houses 12 new ICU rooms. Second floor, 7 new state-of-the-art operating rooms, and we'll talk a little bit about the technology in this building in a minute. But the third floor, 26 new private rooms. This tower would not have been possible without our Ochsner Health partners, as well as our community. Our community also supported this, and so we are so grateful to bring this new building with the latest and greatest technology to Slidell. We do have a new robot, and without our Ochsner Health partners, we would not this would not have been possible at all. We were afforded a robot that is a Da Vinci 5. It is the new, latest, greatest robot on the market to help assisted robotic procedures in Slidell. So there's only 50 of them, from what I understand, in the country, and we have one right here in our parish. So really excited. The technology in this building, we built it for the future. So the technology in a building is going to allow us, and is allowing us today, to do things we've never been able to do virtually in every single room in these buildings. So really excited. The community deserves it, and we're proud to offer high quality care in Slidell.
Great. Just in closing, thanks to both of you. Thanks for your leadership. Thanks for your partnership. Proud to work with both of you and to be your partner, and look forward to together doing great things in the future. And then just all of you, thank you for putting this day together. I was telling Tim earlier, this is a really special day, and this doesn't happen at other parishes around the state. So again, you should be proud that you brought this together. It's just a good example of the great leaders that you have in St. Tammany. just, you know, we're here to help in any way we can. We look forward to working with all of you, and a lot of great things to come, and we just want to be a small part of that. So thanks again for having us.
Pete, thank you. Pete, thank you again very much. What an amazing morning of great discussion, so informative. I want to take just real quickly to do some closing pieces for today. One, I want to say thank you again for all of your time and your commitment this morning to be a part of this discussion. For our sponsors, these events do not happen without your willingness to invest in all the many endeavors that we do here in St. Tammany Parish. Thank you for all of our sponsors to be a part of it. I want to say thank you again to Ochsner Health for being our presenting sponsor. I also want to take a second and just recognize the St. Tammany Economic Development Corporation commissioners. I know we had some. We have Paul Meyer here. Mimi was here. Our immediate past chair, Marty Meyer, who really planted the seed for this event. So Marty, thank you, and also your leadership for the Healthscape. We really appreciate that, former CEO of Sterling Properties. I also want to say thank you to Senator McMath, incredible leader in the legislature. Thank you for representing St. Tammany with such distinction, sir. We really appreciate you being here. Parish Council, we can't do economic development without the support of our local legislators at the Parish Council. Incredible leaders. I know that Jeff and Jimmy were here. Maureen was here as well. Amy with President Cooper's office. Thank you very much. And when we say that we're advocating, trying to advance business investment, knock down challenges and barriers to make that more successful, we do that with an incredible alignment and partnership with our other business stakeholders, primarily with the St. Tammany Chamber. Thank you all for being such champion. Chairman Aberdeen, and what you're doing with the Chamber. Wonderful event yesterday. And also the North Shore Business Council. They are a tremendous partner with what we're doing. We're starting to team up too with United Way, incredible partners. And just a distinction of that kind of relationship. Here we are at an economic development event focused on healthcare because of the incredible impact. But we also have our K-12 superintendent. Been here all morning. Superintendent Jabia, thank you for being at the table with us. You're a major reason that we can be so competitive when we're trying to increase business opportunities. Thank you for you and your team and that leadership. And speaking about team, I'd like the St. Tammany Corporation team to please stand. I want to say thank you for their tireless work. Thank you. Particularly Ashley and Timothy Billett, who were points on this event with Gabby Brown. Thank you all for your continued commitment. And again, where's Joan? Joan, I want to say thank you for willing to step up. She's going to be our incoming president of the board of the St. Tammany Corporation following the incredible leadership of Dr. Wainwright. Thank you for that commitment. I'm going to round out by just two things. One, Dr. Riddell, again, thank you from the very beginning to be willing to help us pull this together. Joan, Sandy, you all are just amazing CEOs and leaders in your own right, and we really appreciate that. The other thing that we want to make sure is to say thank you to our state partners. LED, Abigail, where's Abigail? We want to say thank you. Please tell the secretary we love her, we miss her. She's doing a phenomenal job, and tell her thank you very much for doing that. And our partners at GNO Inc. Eva, are you still with us? GNO Inc. is our regional economic development organization, very important with what we do. It's important that we maintain that relationship, and they're doing an incredible job helping to leverage our impact. One, just an announcement. We also deal with entrepreneurship and helping small businesses in the technical assistance. We have an event coming in November called Inspire Startup Slam, over $100,000 in prize package. So if you're an entrepreneur in the room and you want to compete, please see Chinzo Corona, our entrepreneur in resident. And in fact, we have another partner in entrepreneur, Pallet and Brady and Marty again on trying to bring more resources to the ecosystem along the way. So we're very excited about that. Thank you all again for spending so much time with us. Go forth, be blessed, and we really appreciate your support of economic development.